Good afternoon, everyone. I think I will call the July 22nd Select Board meeting to order. As a preliminary matter, this is John Holgate, Chair of the Nantucket Select Board. Permit me to confirm that all members and persons anticipated on the agenda are present and can hear me. We may have some other people who come in later in the meeting for their particular items. In the order in which I see you, Melissa Murphy. Here. Matt Fee.
Here.
Jason Bridges.
Here.
Christy Ferrantella.
Here.
And then I will go through the staff members who are present. Kathy Flynn.
Here.
Amy Baxter.
Here.
Ken Beaugrand.
Here.
Libby Gibson.
Present.
Tucker Holland.
Here.
Karen McGonigal.
Here.
Janet Schulte.
Here.
Brian Turbot.
Present.
Rachel Gay.
Here.
Roberto Santamaria.
Here.
Erica Mooney.
Present.
We also have John Giorgio from Town Council. John, can you hear me?
Yes, I can. Good evening.
Denise from the Finance Committee.
Here.
Dr. Pearl from the hospital.
Yep, right here, thanks.
And Richard Hussey is here from the Capital Programs Committee.
No, I'm actually here on behalf of Habitat for a real estate matter later.
Oh, okay. Okay, great, Richard. Thank you. This open meeting of the Select Board is being conducted remotely, consistent with Governor Baker's executive order of March 12th, 2020, due to the current state of emergency in the Commonwealth due to the outbreak of the COVID-19 virus. In order to mitigate the transmission of the COVID-19 virus, we have been advised and directed by the Commonwealth to suspend public gatherings, and as such, the Governor's order suspends the requirement of the open meeting law to have all meetings in a publicly accessible physical location. Further, all members of public bodies are allowed and encouraged to participate remotely. The order, which you can find posted with agenda materials for this meeting, allows public bodies to meet entirely remotely, so long as reasonable public access is afforded so that the public can follow along with the deliberations of the meeting. Ensuring public access does not ensure public participation unless such participation is required by law. This meeting will feature public comment as a part of Zoom webinar. Attendees must register to participate. The registration link is unique to the meeting. The registration link can be found in the description of the Nantucket Government TV YouTube live feed for the meeting. People registering to be an attendee must use their names, otherwise they will not be allowed to participate in the discussion. Attendees will join in listening mode. They can click the raise the hand button if they wish to speak. The chair will call on those as their hands are raised at the appropriate times. We also have a Q&A function where you type a question. YouTube chat is no longer enabled. And you can also call in, and all questions should be directed through the chair.
Excuse me, Madam Chair.
Yes.
We have someone on who called in from a phone number that I don't recognize.
The 978 number, could you identify yourself, please?
Yes, Philip Paston with Richmond Great Point Properties. Richmond Great Point Development.
Hi, Phil. Thank you.
Hi.
All supporting materials for this meeting are on the town's website, and the public can follow along. As we turn to our first items on the agenda, the chair will introduce each speaker. Please remember to mute your phone or computer if you're not speaking. Please speak clearly to help generate accurate minutes. For any response, please wait until the chair yields the floor to you. If members wish to engage in a conversation with other members, please go through the chair. Every vote will be conducted by roll call. And I think that covers it. We will turn to acceptance of the agenda. We do have Diane Pearl from the hospital with us tonight, so we'll be adding that to our COVID-19 weekly update right after item number 1. Christy Ferrantilla does have an update for us during item number 1 in regard to the data platform dashboard that they've been working on. And I don't think that there were any other changes. Is that right?
Madam Chair, it's just one additional pending contract.
Oh, yes, there's one additional pending contract that is in regard to the consulting on the PFAS for an island-wide risk assessment.
Yes.
So I will turn to announcements and turn it over to the town manager.
Thank you. We only have a couple of announcements tonight. This meeting is being video and audio recorded, and I have an update from our census administrator. Take the census, feed a family, pay a teacher, fund health clinics, fuel a bus, protect our watershed. These are just a few of the ways in which census data is used to allocate funding for services and programs that benefit everyone living on Nantucket. As some of the lawn signs say, taking it doesn't hurt, but not taking it can. In light of yesterday's White House memo about excluding undocumented immigrants from the census count, so legislative representation does not reflect all members of a given community, please understand that there is no citizenship question on the census, and therefore it is not even possible to gather this information. The U.S. Constitution directs Congress to conduct a census count of persons living in the U.S. every 10 years and does not distinguish between citizens and non-citizens. Currently, still about only 26% of Nantucket's households have responded to the census. So 75% of people who are here have not responded. We stand to lose a lot without a complete count. Please take the census on your own now before census takers begin going door to door in mid-August to follow up with non-responding households. If you do so, not only will you help shape Nantucket's future, you'll also be entered into a drawing for a $100 Stop and Shop gift card. Details are on the town's Facebook page. And again, that is 2020census.gov. I just pulled it up on my computer right now. It's easy to get to, and you can do it very quickly. And there's no select board meeting next week. Instead, there is an airport public informational session about PFAS at 5 p.m. that will be on Zoom webinar with allowable public participation. That's it.
Thank you. Next, we'll turn to our COVID-19 weekly update. And I know that Christy had a couple of comments to make under item number 1, and then anyone else is welcome to.
Thank you, Chair. Erica, do you mind sharing the presentation on the screen? So I just wanted to give an update to the board on where the data platform stands. About a month ago, we voted unanimously to support them in moving forward with a dashboard to support economic health, business health, tourism health, health updates, and all related to COVID. If you can, this first slide just shows you the URL. So if you click that or copy that in, you can go to and see the beta version. And if you can go to the next slide. So there's 5 key components of the dashboard, which are on that website. The community health, which shows the infections level for Nantucket, but it also shows the key feeder markets where people are most likely to visit Nantucket based on historical data from the data platform. The financial health, which will show budget impacts and other both micro level financial indicators as well as national. It'll have Islander demographics that's going to be incorporated this upcoming week, which will show a little bit more about how we can better serve the community that is here on the island. The economic health, which they're still aggregating, will show the state of small businesses and being able to show the impact of COVID on our economy, and the tourism, where visitors are coming from and how many. So there's going to be 5 key components in this dashboard. If you can go to the next slide. So here's an example of what it looks like. This is the community health part. If you see at the top, it says community health and then financial health. That's where all 5 tabs will be all 5 indicators. So this has the vital statistics of how many positive cases we've had, how many tests, and showing you things like our positive, our percent of positive compared to the number of tests. On the right, it also has community benchmark data to see how other communities are affected and what their COVID statistics are showing. And you can see that the data platform put in the note that they've seen over the past few days that some of these indicators have turned red compared to green, just so that we would be able to watch things like this in real time every day to see how the feeder markets are affecting those communities, and then knowing how it might potentially impact our community. If you can go to the next slide, Erica, thank you. So right now they also have the financial health beta dashboard available. So that's showing the financial impact of COVID, what our revenue loss forecast is, and other indicators. They're also working with the steamship to get more up-to-date information. So right now everything is coming in monthly, and they're hoping to be able to do things more daily or weekly. And so that would actually show us some more information about who's traveling here, and also that economic impact of the decline in transportation. Next one, Erica, thank you. So this is a preview of what the demographic dashboard would look like. It's not in the beta version yet, but will be shortly this week or early next week. And so this will help us really understand what our population is year-round, seasonal, and be able to make decisions moving forward on some of the things that COVID affects, especially as we go into fall and winter, which is expected to be very difficult for the island. So right now they're still in the beta testing, which everybody can view and provide comments to Alan and the team. Version 1 will have a new user interface that they've shown an example of for this screen, but all the previous screens are examples of what the beta testing is. And this is just another example of what the phase 1 dashboard will look like. And that's the URL. So I'm happy to take any questions from the board that I can answer, or can relay back to Alan and get an answer to you.
Matt?
By feeder communities, you're meaning where our visitors are coming from, correct?
Right. So that first tab shows the feeder community, such as New York, kind of Philly, those areas, and then also has a community, I forget what it was called, but like similar communities, so looking at Barnstable and Boston and places near us to see if we're in line with similar communities, but also looking at the feeder markets of where people are traveling from.
Anybody else have any questions on that, or any other select board comments before I turn over to Dr. Pearl for the hospital? Oh, Melissa?
Thank you. Just a thank you to Christy and Alan and the data platform. I think this is really helpful to see this data individualized for our community in this way. I don't have any constructive feedback yet, because I feel like I want to go on the beta site and play around. If we have questions, should we send them to you, Christy?
Yes, send all your questions to me, and then I can feed them to Alan. Thank you.
Matt?
Yeah, I think it's great. I'll look at it too. I read something today that sort of, when we always talk about pandemic math, that really struck home. We had our first case in the US in January. 1 million cases was 99 days. The next million cases was 43 days. The next million cases was 28 days. And we are projected to hit 14 days, hit the next million. So that's, you can see the math is how it works. 99, 43, 28, 14. It increases exponentially. So those are the things that, that's a simple explanation of if it starts to ramp up, how it might work. So I think for the public and for us, when, Roberto says, and the hospital says, geez, wear your masks and distance and do these things, they are serious. This is serious. This isn't, something that we are immune from. That's all.
Thank you. Dr. Pearl?
Thank you very much, Dawn, for having me. The hospital feels pretty comfortable in the situation we're in currently. We have been able to ramp up the number of tests to accommodate the people who are asking for them and who are qualified to meet the criteria to be tested. And in addition, as you know, the town has been sending us a large number of people appropriately in the community to screen first responders, lifeguards, nursing home employees, other appropriate people for routine screening. And a lot of private residents have been obtaining and purchasing their own tests. So that's really great. It helps the community in general. The more testing, the more the community benefits, no matter how they're tested. So as we've seen on the data platform, and I know Roberto will be bringing a nice PowerPoint as well, the number of tests now is in the 3,200 range, which is a large number for such a small community. So we're happy that we have seen such a great increase in testing. Yesterday, we had about 140 people come through, which I did think stretched the limits of our capacity, really, given our workforce. But we are continuing to tweak the system a little bit to allow for more testing if we have to. So if the capacity continues to increase, I think we have room still to grow, but it's a bit of a challenge. So we send these tests to Boston, and what might happen eventually is that they will be overwhelmed with the increased number of testing that they're getting, and so the results can be slowed down. To us, that's a big problem because rapid resulting is critical in order to control this infection. That allows contact tracing to be efficient and to slow down the spread. It allows us to find the people who have been exposed and quarantine them, and that's how the spread of this infection will be controlled. So we are hopeful that test results will continue to come in a timely fashion certainly within 48 hours, we hope. After that, it becomes much less effective to control the infection. So I think we're in good shape with the testing capacity. Within the hospital, we have sufficient PPE, and we have well-trained staff, nurses and doctors prepared to isolate and treat people who come in with this infection. We did send a patient off Saturday, I think Monday maybe, with COVID-19 infection, which we thought would be better treated in a Boston hospital. And that patient is there in an ICU, I believe, but is doing well. So we're also interested in the demographic of the people being tested and who are being positive, which I think mirrors the the country in general, which this new infection this time of year is in younger people in general, healthier people. And so we're seeing potentially less severity of illness, at least here in the Northeast. And I think part of that, of course, is the mitigation strategies that everyone is using. The older people are staying home, and anybody at risk is being much more careful than others to protect themselves. And I think that will go a long way toward preventing the types of illness and death that we saw in March and April in the Northeast. So we're pleased with what the community's response has been. We're pleased that we've been able to ramp up and satisfy the demand for testing to date, and maybe that will continue. We're a little concerned that recent positive patients have potentially more exposure in the community than earlier ones, and we'll have to measure that in the coming days to see if that's really impactful. So I know you have a lot more people to give reports, but that's mine for the moment, and I'm happy to answer any questions.
Thank you very much. It's really helpful to hear from the hospital.
Thank you.
Does anybody have any questions? Matt?
Yeah, I guess 2 questions. How long is the testing taking now to get back?
Yeah, the testing takes about 24 hours, sometimes 48 hours. These specimens are sent off at 2 o'clock every afternoon. Anything that we collect after that time is not sent until 2 o'clock the following day. So that's already a 24-hour period. So people will be expecting that result to be 48 hours. And over the 4th of July weekend, some of our labs took a couple of days holiday, and that really set the results back to about 5 days.
And if it's that long, you can't. It's too late. You can't take. You have to isolate them right away, and you can't do trace right away. Yeah.
There's very little value in that.
Yeah. So it's not even worth getting a test if it's going to take 5 days to get the test back. You're wasting your money.
We tested a person recently from Pennsylvania who had a test there before they came here, and by the time ours result was positive, they still had not received the result from Pennsylvania. So some places are still very, very long in the response time.
And the other question is on demographics. I know the Massachusetts dashboard, this might be a Roberto question, and someone asked me to ask this, shares the demographics, the ages and different demographic information. Do we have enough tests and enough here that we can start to, share that more? I know when we only had a couple, it was a privacy issue, but now that we're in the 3,000 range, is that something that we can do?
We have 3,000 tests that we've performed. The results are 36 positive. I don't think the hospital would ever be involved in sharing any demographic information, but that would be a DPH question.
I'm probably never going to share the demographic information, and not until after the outbreak is over. If there's anything that is proven to me, is judging by the way people are reacting for not getting the information, the way they're going to treat the people who they can identify, I would much rather not provide it in an abundance of caution. I don't want to contribute to a dangerous situation that's going to lead to vigilantism.
Christy?
For the hospital for Day and Pearl, we previously designated $100,000 for tests. Is that something that we're still able to cover a lot of tests? Is there more funding needed, or how are those tests going?
So Christy, I'm not really involved too much with that finance part, and that I would refer that to Chris Glowacki as to where that balance is. But I think that there is sufficient funding still for what the town was hoping to achieve.
Anybody else for the hospital? I think I'll turn it over to Roberto.
Okie dokie. So first, before anything, thank you to Susan Warner for my new whiteboard. Much appreciated. It's actually white and it's bigger. All right. So, real quick, just going to go through a few things, just a few numbers here. Thank you, Dr. Pearl, giving the great information. She actually stole my first slide, basically. So what it comes down to is to the day, through the morning, at the end of yesterday, we had a little bit over 3,100 tests. Counting today, we're well into the 3,200s. As far as the funding that the town has paid for, let me do some quick math here, which I should have done ahead of time. Let's be honest. 222 times 150, about $33,000 of the town grant has been spent. People are starting to, some businesses are starting to pay for their people. So when we ask them, is the business paying for it or is the town grant paying for it? Some people who would be funded by the town grant are actually having businesses pay. So that's why some of this information is kind of tiered. So Of the people who are into self-pay and the work pay, you know, what they call in CastNet, are 664, and this is as of the end of the day yesterday. So it doesn't include the information that they're getting now. And about 800 and sorry about that, about 80 to 100 tests per day. We are a little worried that is starting to, like Dr. Pro just said, is starting to I'm starting to stutter, are starting to press the limits of capacity. So we're just trying to keep an eye on that and paying attention to it. But all in all, really good. So with the next group, and this quick overview, over this past week, we did see a quick rise in cases due to a small set of on-island transmission. This is due to a unprecedented situation where a case that was originally considered lost follow-up ended up being responsible for the transfer to the other cases this week in a island business. Everyone knows who the business is. It's all over Facebook. It's all over social media, but I'm still not going to name it. So what's happening in there is that we had the business shut down. They provided me with the proof of the sanitizing from an electrostatic fogger. The contacts were going in to get tested, the close contacts. There is always a little bit of panic that goes into it. So we've been getting a lot of phone calls and a lot of people showing up to the clinic saying, I want to be tested because I was at this restaurant, or that I work at one of their properties. Those aren't considered contacts. And I'll go quickly into the close contact tracing and after this. But it is localized to a small set of workers that do cohabitate. Some are asymptomatic, and the contact tracing is in progress. We are contact tracing. So really quick, the metrics with the COVID-19 positive test rates. So for the number one, I did put that one in yellow, mainly because, so I'll do it really quick. And the next one, the positive tests came back at 2.5%. That is a sharp increase to where we were last week. But if things go well, if we did localize that spread, and if we were able to interrupt the chain of transmission, that will go back to green next week. And in general, we do still have the tracing capabilities. We still have the small cadre of contact tracers who are available in case we start getting overwhelmed, which we're, knock on wood, we're hoping not to. And then this week, we did have a small issue with the sampler at the Surfside treatment facility. We did send off a Sconset sewer test, but I still haven't seen the results from back. I don't believe they're back yet. Really quick, contact tracing. So we hear a lot of words here and there about what is contact tracing and how does it work. So really quick education portion here is, what is a close contact? Well, it's being within 6 feet of people without a mask for 15 minutes or more. You have to have direct contact with any sort of infectious secretion of the person. And that includes, but isn't limited to, sneezing, coughing, sharing food, sharing utensils, and sexual contact. And we do have to say it because this is how we're seeing some of the on-island transmission. That means you have to pay attention and try not to use Tinder, Grindr, Bumble, meetups, other sort of things like that. Going to the parties, going to hookup sites. These sorts of situations are what increases on-island transmission. And this is how some of the on-island transmission did happen. It is not a known secret. It is one of the major portions of public health out there is sexual health. And we do need to understand that even though there is a lot of sexually transmitted diseases, infections out there, this is one of them. COVID is one of them. So we do have to pay attention there. And that does include a close contact. What is not a close contact? If you just walk by somebody at Stop and Shop or in a retail store or something like that, especially if both of you are wearing masks, which is why masks are so important. If you guys are wearing masks and if you just walk by each other, that's not a contact. If you're eating at a restaurant where there may have been an infected individual or not, that's not a close contact, especially if they're wearing masks. Just let's say the person who was sick was a waiter. If the waiter was wearing a mask and they were just, all they were doing was coming up, taking an order, and a food runner was dropping off the food at your table, all of those interactions over the course of the entire meal usually do not add up to even 15 minutes. You may feel like you talk to your waiter a lot unless you actually sit down and have a conversation with your server. That is not a close contact. And a lot of times, a lot of the servers are 6 feet away from you. So they're standing, 3 or 4 feet away from the table. And then if you remember the Pythagorean theorem, a squared plus b squared equals c squared, that hypotenuse from where the person is standing and you are sitting, that's usually around 6 feet away. So and if they're wearing a mask, that transmission doesn't tend to happen there. And then a person who runs by you or bikes by you or walks by you on a sidewalk or a bike path, if you're sitting on the bench and they walk by you, that's not a close contact. We're getting a lot of phone calls from people saying, I ate at the restaurant that or I was at a business that these people were at, a sick person was at, or a person walked by me without a mask. That doesn't necessarily make you sick. That is not a close contact. So it's really important to pay attention on that. And then when we start doing this for you, when we start doing contact tracing, we start having to call people. And if you're watching, if you're reading any of this, I know there's going to be a statement out in the newspaper. It's going to be I'm going to put it out on social media as well. Please don't abuse your contact tracers. They're just trying to help. We've been getting a lot of reports of when our contact tracer calls you on the phone and says, there's information, we have reason to believe that you've come into close contact with somebody who is infected. Don't scream at them. It's not their fault that the exposure happened. So they're just trying to get the information to make sure that you stay safe and that you don't accidentally expose someone else. So what we're seeing here, what you're seeing on your screen, is actually how we start seeing index cases with COVID. You'll call the index case, we'll call it an index, which just usually means the very first case in an outbreak. So we'll say this is this weekend. We'll call it, the index is usually called what's called a F0 generation. It's the first point. Everything after here, that's F1, F2, F3, F4, and F5. Every 3 days without mitigation, COVID-19 can spread to 2 people. It has an R of 2. So this person will infect 2 people. Each one of these will infect 2 others, and so on and so forth. In just these 5 generations, this whole section here is 62 people. So in 15 days, we can have 62 people already sick. Matt was talking about pandemic math. This is pandemic math. So when we call you and we say you possibly were exposed, if we know when the exposure happened and when they were able to contact you, and so you decide that person who is sick or is possibly exposed decides to quarantine, this is how it works. All of a sudden, this whole branch doesn't happen because that person quarantined. Let's say this person lies to us and doesn't tell us the truth, doesn't quarantine, infects 2 others. So we end up getting a case. And then this person quarantines because of it, and they figure out they were sick and they quarantine correctly. This whole branch disappears. By just stopping these 2, it leads only to 17 cases. We cut it in more than 1/3 by just contacting and quarantining. So it is huge. Contact tracing is perhaps one of the most important parts. And I do make the joke, maybe this person lied to us, but we are finding that when we call cases, when people show up to the clinic, when we talk about contact tracing, sometimes they don't want to provide information about where they work or where they're living because of fear of losing their job or any hundreds of different other reasons. So there is sometimes that a case does lie to us, and they do end up infecting other people, like what happened these last 10 days. That's just part of what happens. We cannot control all human behavior. We have to base everything on voluntary compliance, and that's what contact tracing is for. So we're asking that everyone wear a mask, because your proper precautions will prevent you from being one of these cases on this tree. That's a really quick crash course on contact tracing. So really quick, what are the next steps? What I did was put a Board of Health meeting on the agenda for Friday, just to discuss emergency orders if they're needed. Things that are just going to be discussed are possibly closing restaurants. It says 11 p.m., but it could be 12 p.m. It could be never. We could just not choose to do that. Increasing distance from 6 feet to 10 feet, eliminating indoor dining, curbside delivery for retail, increased mask orders. These are all just things that we have already seen in either phase 1 or phase 2 of the governor's orders. These are things that I've already done. It's just a discussion. Doesn't necessarily, we've been receiving a lot of emails and a lot of text message and a lot of phone calls based on what was on about this presentation that's on the packet. It is just for discussion. Honestly, if the outbreak from this weekend and the business that we're talking about we were able to stop the spread, Friday's meeting may not even be necessary, and we may just cancel it. The other thing that might come up is maybe all we need is to just increase the mask order to include the whole island, because of some of the behaviors we're seeing in other businesses. That's really what it is. It's just we're putting this on the agenda to see how this week goes, because we're seeing an unprecedented growth in cases that we haven't seen before, to go from 24 cases to now 34 cases or 35 cases. That's about a 50% growth there. It's just as a precautionary meeting to discuss the necessity of maybe making a new emergency order. If we don't have to, we won't. And then everyone outside, what we really need to do is pay attention to all vigilance, all your masks. If a person is waiting in line for your business, maybe ask them to wear a mask. Post a mask zone signs where people are queuing up. There's a couple businesses downtown, a few retail businesses. I walked by one today that says only 6 people allowed inside. They may be allowed to have more by phase 3 regulations, but they've voluntarily brought it down to 6. These are great suggestions. These are great things. And that is what's going to help us fight this. But it takes the entire community. And it takes everyone here on this board, on the Board of Health, all the staff. It takes the whole community. And we implore you to work on stopping the spread for us and helping keep that curve flat. We've done a great job. We just need to maintain it. And with that, I'll call it a day. Any questions?
Questions?
Give me a reason to use this board.
Christy?
Thank you. I have quite a few questions, but first off, thank you for all of that. It was really helpful, especially going through contact tracing. I know a couple of weeks ago we talked about the Island Home and Sherburne Commons getting tested. Is that still ongoing every couple of weeks, and have all of them been negative so far?
Yes, they are definitely continuing testing at OIH. Dr. Pearl, you might be able to answer this more directly as well. But to my knowledge, everything's been negative still.
Yeah, that is true, Roberto.
And then Dawn, if you don't mind if I go through a couple more questions.
Through your questions, Christy.
Both of you mentioned the capacity at the hospital for testing might be reaching the limits. Is there any ideas of how to expand a testing site? I know the Vineyard has different sites for asymptomatic versus symptomatic, and I wasn't sure if that's something that we were exploring, or a possibility of using a place like the high school or other large parking lot as a drive-through testing.
Yes, we discuss that about every day, Christy, to think what we might have to do next if the capacity or the demand grows. And so we have a few ideas where we can remain on campus because with our staffing is sort of tight, the two types of testing help to support each other. So we might change the timing, for example, of the CASNet patients who are asymptomatic and not ill. If we switch them to a certain time of day, then we can use the same staff to help increase the capacity of the symptomatic test site. So we would like to keep everybody on campus because it helps maintain as much efficiency as possible in the testing. But we're open to adding another site if we have to.
Thank you. With the contact tracing, do we have bilingual contact tracers?
They are available if needed. So far, we've been lucky enough to not have to force interpretation and things like that.
Okay. And lastly, do you want feedback on the Board of Health discussions from the Select Board tonight?
Yes, please.
Okay. So just a little bit of feedback from looking at this. With the restaurants, I really think Matt's been saying for a while now that we need a written enforcement plan, and talking to the business owners, that's really where a lot of their frustration is coming from, is having to be the enforcers of masks and social distancing, and really not feeling like they have the support from the town. So I think any way that we could increase enforcement before increasing new guidelines and restrictions, I think that would go a long way. In terms of stopping the indoor dining or changing to 10 feet, I again think that the enforcement is the issue. If people aren't following the 6 feet in between tables, I'm not sure that they would follow the 10 feet. So if we start enforcing and writing fines, I think that would, again, go a long way. I also think sometimes we're looking at a couple that are not following and then applying it to the mass. With so many restaurants, I think if just a few are not complying, then those should be the ones that we're disciplining and enforcing, rather than trying to hurt the entire industry. And I really think there should be public comment. And so if there's the ability for the Board of Health to accept public comment during the meeting, I think it's important to hear from the different restaurants and retail and other business owners on their thoughts of this before we make a final decision. And for retail, if there's no data showing the spread from going inside retail, I think going back to curbside would just be devastating to businesses. So I just want us to make sure that we're following the data. And if we're seeing cases due to things, try first looking at enforcement before we look at stricter guidelines. So those were all my thoughts. Thank you.
Thank you, Christy. I think that those were a lot of good thoughts. Hopefully be helpful. We did also post a select board meeting for Friday, and we did. If you have any questions, or try and help facilitate public comment. But I'm not sure whether either meeting is definitively going to be needed. I think it depends on what happens over the next few days. Do we know, Roberto, are any other state communities looking at any kind of rollbacks, and like in what cases are they doing that?
Yes, in my discussions with my colleagues at MAHB, that they're the Mass Association of Health Boards, there's a few towns here and there that are discussing possibly moving forward to more strict, is the best way to say it, to make it stricter. So, for example, Cuttyhunk with Gosnold having the 8 cases right now, and 8 cases being 10% of their year-round population, and they have no on-island doctors. They've issued a mask order for the whole island, but they're also looking into other possibilities and possibly making things a little bit more strict. There's a few other discussions. I have a weekly call with my colleagues in Provincetown. They're having their own discussions here and there. They're holding off, but they have a list of possible slide backs. when it comes to the things like retail, that's just what was in phase 2. It's not really on the table. It's just that if there's a slide back needed to phase 2, that's why it had to be on the agenda. But I don't think that that's going to be what happens. And then with the 10 foot of separation, that's actually not for customers. That's for the staff. Because what we're finding is the prolonged back and forth and close contact with staff members in restaurants, they're actually exposing each other, is what it comes into. It's not actually the customers that are breaking that 6 foot rule. It's some of the staffs, keep going back and forth, and sometimes when they're in the back of the house, it's hot. It's hot in kitchens and things like that, so they take the masks down because it's a little stifling, and they end up in some cases infecting each other. So it's definitely just a discussion. We are seeing today just another case, but if it's just one case tomorrow and one case Friday morning, we may just cancel the Board of Health meeting. If it's just one case or 2 cases between now and then, it may not be necessary. It's precautionary, is really the big point.
Can I just ask one more question? I know that the 36 cases sounds a little bit alarming to people who've been here since March, but that is 36 cases over the entire time period. We have 7 actual active cases. Is that correct? Or is it 8 now?
I have the list in front of me. I don't have my thing shared, right? Because I don't want to accidentally break HIPAA here.
And it has
36.
Yeah, 36 total, right?
Mm-hmm.
But most of those people have recovered. There are 7 currently active.
A significant amount of them have recovered, yes. And I believe 7 are active, yes.
And we're afraid those 7 might have exposed other people that we haven't discovered yet.
Yes, correct.
I'm just trying to get a handle on.
Mm-hmm.
Melissa?
Thank you very much, Dawn. Thank you, Roberto, for your report. Generally speaking, I would be in support of a joint meeting even if no action was taken, but just to facilitate conversation again. It seems like the metrics that we're using to evaluate the disease are really helpful, but what seems to be a bit of a missing equation is that community spread piece and the possibility of how quickly that can happen. And so any rules that we're talking about becoming stricter on at the Board of Health or even at the Select Board is based on that concern of community transmission going much more quickly. And that, to me, unless I'm misreading it, we don't really have a metric to measure at this point other than the evidence that Roberto presents to us on that. So I'd be in support of having a meeting to talk about these ideas so that even if there are not actions not needed to be taken this week, we don't know what the subsequent weeks are going to bring, and it would be fruitful for us to be prepared when and if the time should come. I'm a little confused about the transmission piece with the restaurants. If employees I know that they go in the back and they're taking their masks off because they're hot and they're, wiping their faces down or something like that. That likely is not happening in the separation between the tables. So in my mind, and this is why I would really look forward to a conversation more in depth about it at the appropriate time. The riskiest things that I'm seeing with restaurants is the potential for late night bar scene happening. So I'd be much more in support of a curfew, weeknight curfew, weekend curfew. That to me makes much more sense given the community transmission possibility and the just behavior problems that come from that. Again, evidence-based. I'm not sure where we're at with no inside dining, other than that, you know, diners having their faces up, all of these things. So I want to just be really thoughtful that, again, balancing the public health need, which is our number one responsibility, both on the select board and at the Board of Health, with social, economic, health, and opportunity for the businesses, and that we're being really strategic and thoughtful in our messaging about how the disease is being spread and why 10 foot to 6 foot would make a difference in a space. And I agree with you, Roberto, this may not even be an issue if we don't have the numbers towards the end of this week that justify changes, but I do think it justifies the conversation. So I'll just say again, I'm very much in support of having a conversation. So when we do need to take action, we've vetted it and we have a sense of where we need to go. Roberto, can we just go back to contact tracing for 1 second? Because I know that you've probably seen them on the news and social media. Other communities may post a notice if you've been to such and such business during these days or this time, you may have been exposed to COVID-19, call your doctor. Why would we not want that kind of messaging going out, particularly if it's a business exposure? Individual data, I totally understand, but I just think it's important that the community understand very clearly why that messaging is not necessary. Thank you. That was a long-winded question.
We can always say, if you were at this business, you may have been exposed to COVID, but it causes undue panic. COVID is spread through droplet format when it comes to coughing and through contact. It's not fully airborne like measles. So posting a business in a full airborne transmission, having dealt with a measles outbreak myself when I was in Framingham, this is how you do it. Because measles stays in the air for approximately 2 hours, and if there is movement of air in the same, it can stay in the air even longer because measles is incredibly small and highly infectious. We talk about COVID having an R of 2. Measles has an R of 20. So for every one person who gets it, 20 people can get it. And so it is incredibly contagious. And the standard protocol and procedure is you post the business. If you were in the case of the Framingham, if you were at Trader Joe's on, let me see if I can remember the dates. I remember it was the 17th and the 18th. I just don't remember if it was February or March of 2014. It was, and you can just say if you were here between the hours of 10 a.m. to 8 p.m., which was the person's shift, you may have been exposed to measles. If you do not have a vaccination or if you choose to have a booster vaccination, please contact the local health department or come at our clinic at this and this time. That's the standard protocol for an airborne transmission virus. For those who believe that COVID is an airborne transmitted virus, that's the way you handle that. The research is showing that COVID is not an airborne virus. COVID is transferred by fomites, which is droplets. Somebody sneezes and it sticks on something. You wipe that, you don't wash your hands, you wipe your eyes, you pick your nose, it gets into your body. So that's really how it translates. So to say, if you were at the restaurant, we'll say, if you were at the restaurant from this last weekend, just because you shared a table from where this infected person was, doesn't mean you're going to get it because you wipe down the tables afterwards with a sanitizer. You're not sharing utensils with the person. You're not coming into direct contact. So to post a business would cause an undue panic. Just because a person happened to be there who was sick doesn't necessarily mean that the patrons got sick.
Yeah. Don, may I add a few things? And the other reason I would say not to start that kind of information overload, Melissa, would be that those people don't actually meet the criteria for exposure. So if they started to swarm in here, which they are doing, then we'd have to say, because you ate in that restaurant doesn't make you have an exposure, and we actually can't test you. And so then there's this round circle of fear and anxiety. And I think the best approach for the Board of Health will be to respond thoughtfully in a way, depending upon how these things are being transmitted to each other, and not just have a reaction to do something because the numbers are rising. It's been, I think, very gratifying that we haven't found community spread. We are still able to trace every one of these cases, just about every one, to either a travel or to an exposure. So it's not as if I pick it up. I haven't left the island in 11 months, and as far as I know, have no exposure. So if I came in with it, it would either be the Stop and Shop or my office or my home. So then we'd start to worry if we saw anybody who's just been here a long time and has not been exposed come in with an infection. We'd have to start scratching our heads. Where did this come from? It was this. How did this get picked up? So we aren't seeing that yet, that kind of community spread. And that's we're really grateful for that and hopeful, because these little enclaves of infection that we've seen, several of them are related to each other. This person is related to that person, and now that we have 3 or 4 related to each other, it's not explosive in the community.
Melissa, did you have a follow-up?
I did. I wanted to thank you both for being so clear on that, because I think it's important for the community to understand the reasoning why, and I appreciate both of your descriptions, both on the release of names and community transmission spread. So thank you.
Roberto, then Jason.
Just one last thing. It was asked about community spread metrics. If you don't mind, I'll share my screen real quick so I can just do a quick metrics that one of the other towns, actually Provincetown, is using. Once again, what you see on your screen right now is actually one of the dashboards they're using for Provincetown and how things work. So they have a series of metrics on, how much it can affect their ability to respond. So they have things from first responders, health department, police, DPW, community health centers, things like that, and everything from specific variables and how important these sorts of things are. So I'm working with Morgan at Provincetown to adapt this for us so that we can look at community spread, and if it becomes a situation, how dangerous has it become to our ability to respond. I can forward this to you if you want. It's not adapted to us yet, so it'll be a little bit hard to understand, but it's definitely something we can look at.
Yeah, I have one.
Thank you, Madam. I've got 2 or 3 questions, comments. I just flip through them. So back to the business what happened the last 2 or 3 days, Roberto. This is also a question for John Giorgio. So the first is, have they complied to the point that you wanted them to comply? Are they complying well? Do you feel comfortable with them reopening? And if you didn't, can you stop them from reopening? And can the select board stop them from reopening? Or is it Board of Health? But any business, or particularly this one, however you want to answer that, Roberto.
So I'll answer the first part of that. As far as cleaning the business itself goes, every surface that the public would have touched, and including the back of the house areas, were sanitized using an electrostatic sanitizing sprayer. The Nantucket foggers actually did it. So that is definitely the protocol. It's actually the same protocol. And then I see Diane O'Neill here. It's actually the same protocol we use in our schools to sanitize the schools. They're using exactly the same foggers and the same information. So we do feel good that a third-party sanitizer did that. The area that we have a little bit of concern is actually the dormitories, where these people are staying. because that sanitization is actually based on what they're doing as a living space. It's governed by kind of a different set of rules. So that's a little bit harder. We would like to see that sanitized professionally as well, using the same foggers and the same sprayers. But yes, they would need to sanitize to our standard, especially if they're staying in an area of the public. I'll leave the closure question, other than the CDC closure that we're allowed to enforce through the orders. I'll leave the Board of Selectmen, Select Board closures to John Giorgio.
So both the Select Board and the Board of Health have issued specific COVID-19 orders. And in just about all of those, there are enforcement provisions that allow the town to issue fines for actual violations of the orders. And also, they allow the town to seek injunctive relief if there is a persistent violation. So in terms of singling out a particular restaurant or a particular business, that would have to be based upon violations of a Board of Health or Select Board order. If they're complying with Roberto's directives, then I think trying to shut them down or reduce their hours as an individual establishment would be problematic, Jason. If there are general problems with activities across the island or across a particular industry or service component, then that should be the subject of or consideration of an additional order that would apply to everyone.
Okay, Madam Chair, I have a follow-up. So we can't legally force someone to tell us where they live or who they've been in contact with the contact tracing, right? They can say nothing, they can plead the fifth, they can give us misinformation. If we feel that's happening, is that enough to fine or shut somebody down? If Roberto does not feel comfortable that he's getting the information that he needs and or hospital, what can we do?
That's a tough one.
Mm-hmm.
Did you want me to answer that?
Anybody can. If we don't know, then that could be the answer.
Yeah. So again, I think if there's some kind of malfeasance on the part of the owners of the restaurant, then that would be a different story, Jason. But the mere fact that there was an outbreak in a particular restaurant without demonstrating a violation of an order or not cooperating with the contract tracing, I think that would be problematic. Sorry. So I would urge the boards to concentrate on actual, what I'll call malfeasance, as opposed to just, bad luck that the outbreak occurred at a particular establishment.
Well, that's the thing, John, is it's more than bad luck. If somebody's not, and this is hypothetical, if someone's not complying and not giving information to the contact tracers, I feel like could there be a case?
Yes.
Make sure that the Select Board is supporting Roberto and the hospital and whoever needs to make the decisions to not let any business reopen, to close them down, to fine them if they don't feel that they're taking this seriously. So I'm just trying to find.
So that would be a circumstance where I would call that malfeasance, Jason, and perhaps we could take an individual action in that circumstance.
Okay. Thank you.
Matt?
Yeah, on that point, what New York is talking about doing is 3 strikes and you're closed. They give you a warning, they give you a stiff fine, and you continue to do something you shouldn't do, and they close you until they're out until we have a vaccine or this is over. And so, so that goes to the enforcement issue, and so if we enforce and we are doing that, then you have a carrot and a stick. We want everyone to do the right thing, but the people that are pushing the limits get a warning, and then they get a stiff fine, and then they'd be on the knife edge on this. So people are doing it different ways. I'm not saying that's the right for here. I think was right about enforcement. I heard from restaurants that want, they want some help. They want some enforcement. They said every Saturday when this changeover happens, they have to train all the new people that are coming in to our rules. Everyone's coming from different areas that don't take it as seriously. They're not wearing masks. They're not particularly nice. And it takes, Saturday and Sunday and Monday to get people, the visitors to pay attention. So they're doing a lot of extra work to try to get people to comply. So that was sort of just, and the other point is that the people from outside of New England are not quarantining. We can recommend it. They say it's recommended, but they're not quarantining. They come here and they're on vacation and they're on vacations. So, that's another issue that the restaurants are dealing with. They're dealing with people who they know are from places that have an issue right now. And they even are dealing with people they know who have had it or who has it. People are still coming to dinner. So, so there's some issues going on that I think would be really important to discuss, on Friday or if necessary. And I think, and again, I think I would love to see a written enforcement plan, and I would like to see it in writing so that when we have to enforce a little tighter, so I know what we're doing now in writing. And so if we have to change it, I'd like to know what we're going to change it. And that, includes who's going to do what, when, where, how much is it going to cost, why are we doing it? Just, a tip. It doesn't have to be a 20-page document, but it needs to be in writing and understood and agreed upon. Because if this thing starts to go sideways, I'm worried that people will all say it's not, that's not my job. That's not mine. Oh, the Board of Selectmen made a bad choice. Oh, the Board of Health made a bad choice. I said not to do that. We need to all be united. And the way you do that is with planning and contingency planning and strategic planning. You make sure you know what you're going to do, when and why. And, I bet Roberto has a lot of it written down already, or a lot of it in his head. We need to have that and react to it. I think the biggest, our biggest risk right now is that 10 to 2 in the morning. And it's the young people who work for me and work for everybody who think that they are, that's what is causing the problems for the most part around the country right now. Mm-hmm. And the places that are rolling back are the ones that are rolling back bars and inside restaurants, et cetera. And, and places are, the other comment is places are, some are, Somerville has stayed more strict than Boston in the state. And they've done that because they would like their kids to go back to school this fall. They've said, we're going to try to do this. It may help us. It may not help us a lot, but it might. We want our kids to go to school. And I think that we want our kids to be able to go to school safely this fall too. So I think that, some of what, having a plan and, would be really important.
Jason?
One last thing, Madam Chair. Thank you to John Giorgio for answering those questions. On the, Roberto, on the next steps, the only thing, I think all that to discuss is fine, and I look forward to the conversation on Friday if we end up meeting. I think one missing big bullet point is enforcement. And I know there's a bandwidth issue with staffing, and it's not easy, but I think enforcement should be, a first step before, going forward with all of those or some of those. I just think that we should have that as part of the conversation. I didn't see that in the next steps.
I'd like to echo that. I'd like to see us enforce the people who are not complying with the best practices before we put restrictions on everyone that may not need it, that are voluntarily closing at 11 o'clock and those kind of things. We just need living.
Just wanted to add a little bit about the enforcement. As everybody knows, we do have limited staff, and we are doing the best we can to enforce after hours. These people are all also working all day, every day. So there is a bit of an issue there. There's a bit of burnout right now. It's not that pleasant to deal with people who've been drinking at, whenever and tell them to wear a mask, and they say a lot of really abusive things to you. So we're all dealing with that. With regard to a written enforcement plan, John might want to jump in here, but I don't know of any town that has such a thing. All of the enforcement procedures are in the orders and in the existing regulations. They spell out exactly what the enforcement is. So if the enforcement staff or inspectors see a violation, I don't know that there's anything to really talk about. They can enforce it right then and there. I don't know what, Matt, I know you've been asking about this, and it's really hard for us to sort of pinpoint exactly what you're talking about. I mean, we could put in a document, liquor violations are enforced as follows. Mask violations are enforced as follows. Social distancing violations in restaurants are enforced as follows. We can easily do that. We can put it on the website or whatever, and we can list out what the fines are. And the enforcement staff can get out there. We obviously want the enforcement to be random, and the inspections and the visits to be random. I'm told there's I think it was called a telephone tree. So when inspectors hit one place, it rapidly gets spread around to everywhere else, so that by the time they get there, everybody, oh wow, everybody's in compliance at this place. So it's really difficult. If we had 5 teams, they could blanket the town with an enforcement action. We just do not have those kinds of resources. I think it is very good to know that the select board, and probably the Board of Health, if this discussion happens on Friday, are fully behind the town staff for the issuance of fines and violation notices and things of that nature. Some of these violations, take some time. For example, I've heard there's underage drinking issues. That's not a COVID-related matter. And we typically, throughout the summer, have our annual sting operation, which has been a bit delayed because of everything. And that's getting going very shortly, if it hasn't already started. But as you all know, that's a process that eventually culminates in a hearing that requires notice. So there are processes involved in all of this. And we're doing our best to get around to it. Can we try to get more enforcement done? Yes, we will certainly try to get that done. That may entail that some staff people will have to cut back on some hours during the day, possibly, and focus more at night if that's where the problems are. And as far as there was a suggestion that private citizens could take photos of things and send them to the enforcement people. That will not work. It's a good idea, and it seems on the face of it to maybe be something that the public could help out with, but that is not a legally sustainable action. I don't know if John wanted to add to any of that.
Yeah, I'm looking at your emergency order 12, which was the face mask order, and but about half of that order relates directly to enforcement, the when, how of enforcement, the fines, the injunctive relief, and so forth. And so I think that it's, the appropriate place to look to address Matt's concerns would be perhaps adding additional items into the enforcement section. But that's not going to solve the problem here. The real problem is what Libby is talking about, which is where's the person power and the resources that it would take to actually enforce these orders island-wide. That's a personnel issue. I don't think. I think the orders themselves have the backbone in terms of all the various enforcement options, but you need people to actually enforce, and that's going to be the issue. In terms of taking pictures, if somebody's going to be issued a fine or other action taken against them, the person who notices the violation has to be present to notice that violation, and just being sent a picture, in my opinion, would not be sufficient, most likely, as the basis for issuing an after-the-fact ticket. The ticket has to be issued on site when the violation occurs, issued by a person who observed the violation. I can see Amy shaking her head up and down. But so it's really a question of the personnel that you can deploy to enforce.
And I'll just, if I can.
Yeah, Matt, go ahead.
Yeah, and Libby, where you went near the end is where we need to go. Who's going to do it? What's the most dangerous times? When are they going to do it? How are we going to handle that issue? When you're planning, you dig down into each one of those topics, and you say, okay, how we, who's going to handle it? How are we going to change our hours? That's a problem. Okay, we'll solve it this way. Like, we need to have that. And right now, I think we could probably find a way. But if this thing starts to go sideways and we need a lot more, what are we doing then? And part of it is we're talking about sort of maybe closing sort of the bar business earlier, that could have an impact on people. But if we can't handle it, man, it may be the only choice we have. And I'm with everybody of just enforcing now and dropping a couple fines and making sure people do the right thing. But I think, so anyway, it's not just in writing, it's who's going to do it, how they're going to do it, what different staff are involved. And this should be across all departments that can do this. They have the ability. We should find creative ways to make sure this happens. It shouldn't just be Amy and Roberto and a couple of people from that office. There's, part of the planning would be who else can help? How can we reposition them? How do we do this? So that it works.
Amy?
Thank you. I just wanted to comment on some of this. I just want to assure you that it has been cross departments. We've been out there. I've been out there with Chief Murphy and some folks from fire department, from health, from others on 4th of July, on Saturdays, Sundays. We've been out there till midnight. Which is now well past my bedtime. We've been out there. And I think the approach we've been taking is there is the phone tree, so they certainly know once we get down there, but is really approaching each restaurant, talking. They see us, they call us over. Amy, I'm having trouble with this, I'm having trouble with that. There's a handful of folks that push it. We know where those are, but 95% of them are doing the best they can. I think with my discussions with them, we certainly are, and a lot of people support maybe pulling back to midnight, 11:30 last call, and allowing them a late seating, but certainly pulling it back. Nothing good happens after midnight. People get belligerent, and a lot of them are asking for help in that. But we have been out there, and I think the agreement at the beginning was to work with everyone, have conversations. When I do hear complaints, again, secondhand, I'm not going to issue any sort of thing other than a warning saying, I've gotten this complaint. I didn't see it for myself, but cut it. And we have a discussion, and usually that we can get to that problem. And I've seen a lot of things improve by that. And we've all been talking together as a group. So I just want to assure you that I feel like these folks, for the most part, have to keep people safe on a good day. Before this happened, health restaurants all the time. I mean, they're used to a lot of these things, and they're relearning all these new things. So I feel like we've been approaching it in a just not trying to slap down, but trying to, how do we work together to do this? So again, we have all been out there. It's not been just Roberto and myself. And I've issued some written warnings on a couple of things. And I felt like they were responded to as well. And even a couple of the problem spots have been working with me as well, but they need help too. Again, like you brought up with some of the enforcement and some of those ideas as well. So I want to keep working with them and not making it too punitive as much as we can. And so I just kind of wanted to make that comment. If there's any questions.
Matt?
I think the effort, doing it proactively, doing it, in an agreeable way. I'm not saying that we don't do that, but it's sort of sometimes when we do the liquor stings, we go and we do everybody. But if you have 2 or 3 problem spots, deal with the problem spots. Don't go in and trick people who aren't problems. And so it's the same thing with this. If we are, if in our enforcement, if in our observation, there's some places that are more of a trouble than others. Those are the ones that we should get the attention, because it's not fair to the, 50 people doing it right if the 3 or 4 people that aren't, may force everybody back. So we are not doing anyone a favor by letting the miscreants get away with it.
Christy, then Jason.
Matt said basically what I was going to say, so I'll let Jason go.
Jason.
Thank you, Madam Chair. I really like that approach in the beginning because this was so new to everybody. Outdoor dining, where were people going to line up and they were waiting for reservations? So I like the approach of working with all the businesses, retail, restaurants, everything, but not anymore. Everybody knows what they should be doing. Everybody knows. If there's 5% that's not complying, I want to see fines. I want to see them closed down. Everybody knows what they should be doing. And so if there's any problem, I want to make sure that licensing and health and anybody else, at least you have my backing. I don't know about the rest of the select board, to make sure that's not happening anymore. Everybody's had time to work out some of the issues and say, oh, I didn't know that. Oh, I didn't know that table was, those chairs were 3 feet close to each other. I want to see a tape measure on every manager's side, right? Like making sure, like everybody knows now. So I think the gloves need to come off, and I think there needs to be fines, and we have to be serious about it. Or all the things that Roberto is suggesting and more is going to happen. And so like Matt said, having, 2 or 3, what do you call them, bad apples, or people who are pushing it a little bit for whatever reason is going to ruin it for a lot of businesses that are working hard. And all the work that the town staff has done of trying to adapt with the streets and push permitting through really fast. I don't want to see that go to waste. Thank you.
Melissa?
Thank you, Don. I couldn't agree with you more, Jason. I feel like we have, everyone is exhausted. And I think our town staff is, I think the restaurant owners are. In the face of a pandemic, I can't think of anybody who is not working hard to preserve their livelihood and keep their health all at the same time. If the one key thing we can do is amp up our enforcement to penalize those who are not in compliance and not playing by the rules so that everybody else can, it's exactly what we need to be doing. And I'm disappointed to think that there are businesses that will push the limits of what the rules are, because I'm sure that they're fearful of not making enough money this year. And while I understand that, that's not acceptable behavior and it puts the community at risk. So I don't, I also want to just go on record to say that I think that that can happen at the same time that curfews can happen, because I actually still believe that the curfews make sense regardless of bad apples in the barrel. I have believed that since the beginning, and I continue to believe that restaurants can make, and restaurant owners have said this, they can make a good livelihood with a curfew. It's not necessary to be open until 1 a.m. And yeah, so I don't know how I agree with you, Libby. I'm not sure that we need a written enforcement policy or a plan, but I think knowing that there is the commitment from all of the officers who are allowed. And I think it's important that we understand that it can't just be anybody who goes out to be an enforcement officer. There are very specific people within town administration and who can be enforcement officers, but to the best extent possible that we deploy them over these next couple of weeks to make sure for the health and safety of everybody that if the few bad apples are weeded out and fined appropriately, I think is of paramount importance.
Oh, thank you, Melissa. Can I just ask one question? I'll go to you, Roberto, on what you were saying. When you talk about a curfew, you're talking about an earlier closure for businesses. You're not talking about a police enforced curfew, or are you? Because the chief had very big concerns with trying to enforce a town-wide, everyone has to be in their house by a certain time.
Was that to me?
No, that's to Melissa. She said curfew. I just want to make sure I know what she means.
Yes, no, I'm sorry. Yes, I'm being very, that's a broad word. My recommendation is for the restaurant closings. I think I had seen some ideas of Monday through Thursday, closing at 11 p.m., weekends, midnight. That's what I mean for restaurants specifically, not island-wide curfew.
Okay, thank you. I just wanted to make sure that for the public, they knew what you were referring to. Roberto?
So I really appreciate the support for going out there and fining. We can definitely go out and start fining a lot of people just from what we see in the middle of the day, both in businesses and on the public. But if we start issuing, we got a good amount of pushback over the one fine we gave on Atlantic. So when the accusations of heavy-handedness, when the accusations of being a police state start happening, I want to know that this board is going to back us on it, because I'm the one that's going to get hammered on social media, in the newspaper, because of us being too communist, too fascist, or whatever the hell other things they're going to throw at us. I want to make sure that I want a vote of confidence from this board, because all of us are going to stand there together saying that this is what's going forward, because we're going to get a lot of pushback from the amount of tickets that we're going to give.
Can I just ask one question on the tickets? I know that one of the concerns with that fine was that the homeowner and not the tenant received the fine. When it's like a restaurant business, if they have a landlord, does it go specifically to the business? Because they have more control over what's happening than the landlord does.
Here downstairs at downtown, we're going to be issuing it. If we see it in the business, we're going to be issuing it to the business. Just like with snow removal, they're going to be responsible for their queue on the sidewalk.
Yeah.
And so there's people that I can easily just walk 200 feet in that direction and take a picture of 4 businesses that probably aren't policing their queue right now, and I can issue $300 in tickets as soon as I log off today. I just want to know that when that happens, I want the board to be unanimous in saying we support these tickets.
Does someone want to do you want a motion to that effect or a consensus, Matt?
Well, Roberto, this is where a written, description of what you're going to do and how you're going to do it would be helpful, because I'm not saying we walk down and you go to, the line at the juice bar and give everyone a ticket. And I don't think it's a juice bar's response. That's part of the problem. They can't. How do they have people out doing that? But I'm saying if people are turning their restaurants into bars, and if they're pushing chairs up, putting 4 tops up, and people are there from 11 till 1, and it's a bar, then that's what I'm talking about. And so, and I'm fully supportive of figuring out the right way to do it, but we're not going to decide that in an hour discussion, tonight. But I think that we need, but I think we have to be aware, that's why I think putting it in writing, everyone knows, here's what we're doing. Here's how we're doing it. Here's why we're doing it. Here's who's doing it. And I'm not so sure that it has to be, I'm not so sure we couldn't deputize people. If we did a plan and said, how are we going to do this? Maybe there's a way John Giorgio could come up with to say, hey, you could do it this way, but we have to do that. So maybe you guys have already done it and looked into that, but I just think we have to really turn over every stone and look at it.
Jason?
I'm glad Roberto said that, so we can continue this conversation on Friday or tonight. I'm referring to the next steps that's in your report, Roberto, of closing down restaurants, increase outdoor distance size, those type of things. Right? I'm not seeing anything about queues at ice cream shops. You're not pulling those back. I'd like to see enforcement and support you guys, because Amy said they're seeing bad behavior, about 5%. That's what I was referring to. On if you're seeing that, I think people understand now what they should be doing. So. Thank you.
No, absolutely. And when we're talking, we're here with our masks. Absolutely. The emergency order 12, just like John or Giorgio just said, has the steps on how we're going to enforce in it. And I'm looking at it. So the mask order, for example, is one of the things I'm going to be enforcing on. If we enforce it the way it's written, we have to make sure it's non-discriminatory. I know you're worried about the bars or people who aren't paying attention in bars, but it's not just the bars who aren't paying attention. It's every business that aren't paying attention. And if we find just bars and ignore the queue that we see in the line right here and ignore the businesses that are going in there, it takes it away from us. And and that's the thing, once again, the person who goes down for it is this guy.
Matt.
I don't think we're not going to get much more on this tonight. I think there is a measurement. There's a sort of common sense, and there's a way to do this. This reminds me somewhat of, sort of when we talk about ticketing, and the next thing you know, we don't see a ticket, we don't see a policeman out, and the next thing you know, not to beat up on the police, the next thing you know, we get to, stroll weekend, and they run up and down and they ticket every car, and everyone's upset. That's not what was necessary. And the same thing here, if we have, you don't just pick it, you don't pick it so everyone gets mad so you don't do it again. That's passive aggressive. What we need to do is say, what is the right way to do this? What's the way, walk, and who deals with it? I think if you went to the line, a long line and said, hey, everybody, 6 feet, they would all do that. I think they would. And so anyway, we're not going to solve it tonight, but I think sometime, but this is showing me that we really have some issues to sort out.
The problem with COVID is that it's not common sense. The way, when you're dealing with population, human behavior, there is no common sense. What you consider common sense is not what I consider common sense, which is not what the people in the street consider common sense. We have the written ways in the mask order, and we can enforce the way it's written in the mask order. And we're going to enforce the way it's written in the mask order. And then if any other emergency order that needs to get drafted or written or voted on in the future, we can put those enforcement orders, those enforcement procedures in there too. But not everyone is going to understand the same way that it gets enforced. So we might find ourselves at an impasse here because may not like the way we enforce. And the public is definitely not going to like the way we enforce.
Kristen?
I think when I talked about increasing enforcement at the beginning of this discussion, I more so meant more of an education campaign in the sense of, when I walk around downtown and I see somebody without a mask, I point to my mask. If we could have more, more kind of the COVID educators or more people out there, what I'm hearing from restaurants is it's all falling on them for them to tell people to put on their mask. And again, they're dealing with the belligerent people and the rudeness. And I know that nobody else wants to take that on, but it's all on us to keep our community safe. And as many of us can be out there reminding of the mask order, I know that we have the table during the day, but is there anything else that we could be doing at night that is just reinforcing that we have this mask order and trying to keep our community safe? Because the signs aren't helping at night. So I think that was more so of what I was trying to get at. Is how can we have the tools and resources to help our businesses and keep our community safe? And I think, maybe that is the fines. But if we go to the extreme of finding every single person on the street, I'm not sure that that's going to also result in the end result that we want, which is the compliance.
Well, I was thinking, just for a little bit of input, and I'll go to you, John Giorgio, is the more egregious situations, there should be some tickets issued before we start rolling back or giving restrictions back to all businesses or all citizens. The people who are really violating it should receive a fine. John?
So, yes, I wanted to point out, we've been referring, and Roberto has as well, to the Emergency Order 12. In all of those enforcement provisions, I want to read to you a very short provision. Notwithstanding the foregoing, agents and officers are encouraged to educate offenders and to exercise their judgment on a case-by-case basis, and they may issue verbal or written warnings prior to determining that an offense has occurred. So again, I think what I'm hearing is the board wants to enforce these orders, but there's an element of discretion that's going to fall on Amy and Roberto, and all of that discretion and other options are set forth in the order. So something the board may want to consider is a vote to reaffirm the provisions of the existing order, Emergency Order 12 with regard to how these orders will be enforced. And that includes the education component as well as fines, injunctive relief, ticketing, et cetera.
Don stepped away. Oh, there you are, Don. Sorry.
Sorry, I'm back.
Melissa Henry.
So does anyone have any questions on what John just said? Melissa?
I don't have a question on what John just said. I appreciate what John just said. I feel in some ways this conversation got off the track. We started talking about restaurants and enforcement of restaurants because that's where the focus, one, of the new cases are, and two, where the focus of the conversation, perhaps a joint conversation between the Board of Health and Select Board, was going to go in terms of having more significant restrictions or going backwards. And I think I don't want to confuse the mask order and fining people for the mask order on the street who are standing in line. If that needs to happen, that to me is a separate conversation from the one we were having, which was about enforcement, particularly of restaurants, particularly in those late nights after 10 p.m. I think I heard from almost every board member that the concern is, and even from staff, the concern is the behavior that happens from 10 p.m. to 1 a.m. And so I think what I'm suggesting is that at this point, when we go into a restaurant to do enforcement and inspections, at this point, the education period for them may have been exhausted. And I do think there's a significant amount of discretion, and I do trust our enforcement officers to use that discretion. But at this time, I think restaurants have had ample opportunity to operate and understand what the rules are. And if they're not playing by the rules, then perhaps it is time to have fines so that we can, the purpose of the fines is to reduce community transmission of COVID-19. It's not to be punitive to just be punitive. And I think if we start to see through enforcement that there is a need to be stricter because either we can't enforce if we don't have the staff or the manpower to do the enforcement, or that because people are simply not complying, or there's a significant risk of the spread of the disease, then that's when we need to talk about being stricter than the state in terms of a rollback on our rules. I really don't think that we need to be more aggressive on our downtown mask order unless, and of course, you as the enforcement agencies see that that needs to be possible. I'd really like to not confuse the two issues and stay focused on what we were talking about, which is the restaurants, and in particular, the restaurants from 10 p.m. to 1 a.m. In my mind, that's what we were talking about.
I know that has been a concern for people. Do we have any evidence that there has been a spread because of table seat alcohol involved? Because we had made a conscious decision early on. We discussed it on whether we would allow, if they're seated at tables, to just be served drinks, because we talked about maybe it would only be dining service. The kitchen would have to be open. So I just want everything to be somewhat data based here in terms of how the spread is happening. Matt?
Yeah, the workaround on that, Don, is to order dessert, and you can drink as much as you want. You know, that is, so people find their ways to do this. You know, that's the workaround.
No, but we allowed it. We allowed for them to be served.
I know. The other point is, are we maybe missing up policy and procedure? We've got a policy in place, but the plan is the procedures. How are we going to enforce that policy? You know, I think we're getting caught in the weeds talking about two different things.
Yeah, and I mean, I think that we do need to go back to trusting our officials and backing them up in terms of their enforcement actions. And I do stand behind what our public health officials choose to do in terms of enforcement. And I would like to see those kind of actions take place on more egregious issues that might be happening before we take actions that are town-wide. Melissa?
Thank you, Don. And I don't know that there's necessarily evidence, but I think the purpose of the discussion, and particularly of closing restaurants, is that, as Matt noted, anecdotally and evidence in other communities, we can see that that is the highest potential transmission. And that's what we're trying to be proactive, not reactive for. So in my mind, enforcement during that hour and any policy change that would support restaurants closing a little earlier than we had previously thought curbs that behavior, because we cannot, as Roberto said, apply common sense or personal responsibility to people. Some people just will choose different behavior. And to me, that is the closing time of the restaurant is one thing that we can do either as a select board or as a board of health to allow businesses to have great food service, take care of their customers, and not create a bar scene at night that is potentially dangerous and risky. And if we see restaurants restaurants operating in that way through inspection, then yes, warning, fine, all those things are appropriate, because it's not in the community health's best interest to be operating like that.
Yeah, no, I agree that it's not in anybody's best interest to be operating like a bar. And I know a lot of the places that have had the serious issues actually did reopen their bars. And so if anything here is turning into, it's not what we allowed. We allowed table service. And I'm not against closing earlier, but I think we definitely need some reasoning and some significant input from the affected industries. Christine?
Yeah, I was just going to add that talking to restaurants over the last couple of days, you know, most are closing earlier. They're choosing to close at 11 or 11:30 because they haven't wanted to deal with the hassle. Also because they're just short-staffed. Everybody's short-staffed this season. And so think some of them are taking it upon themselves to close early, but I do think it's something that we could discuss maybe on Friday, but having the input from restaurants and some community members about kind of how they could move forward. I think, again, putting through, I want to say curfew, putting through the restriction for all restaurants when we're maybe concerned about one or two, it might be worth having just a more detailed conversation that I don't think we're really getting to tonight.
Yeah, if you all don't mind, it is 7:15, and we have quite a few more items on the. I think that we're at the point where we can see what's happening over the days, and there are meetings posted for if needed, and we probably want to have them anyway to continue discussion. Is that okay? Did I break up? It said my internet was unstable for a minute. Okay. Were there any quick PIO comments, Libby, before we end COVID for the evening? Okay.
No, not really. Just keeping up with it.
Okay, thank you. This is the public comment portion for items not COVID-19 related. Anything that's not otherwise on our agenda that you'd like to bring to our attention? Claire?
This is Howard Dickler. I have a question for the hospital. The system that has been proposed is really built on the ability to test and get the results back. And getting the results back is okay at the moment, but we've been told that there's a danger that Boston will get overwhelmed, and that would throw the whole thing into chaos. So my question is there any possibility that the hospital can do its own testing? Is it a question of money? Is it a question of the technology being available? What is the situation? Thank you.
Thank you, Howard. So we do actually have the capacity to test here on Nantucket, which is an analyzer we have in our lab, and the result is back very quickly. However, getting the reagents for that machine is very difficult because of the supply chain issues, again, when there's so much demand for all of these kinds of tests. So we are able to get a small supply and are keeping as much as possible those tests for very urgent situations. A woman in child birth, for example, if we can't test her or the baby, then she'll have to be isolated from the baby upon delivery. And there are a few other kinds of important moment-to-moment needs for those tests. So if that were widely available, we would test here on Nantucket, but we would still run into those same limitations.
Thank you for answering that, Dr. Pearl. Thank you for your question, Howard. We are going to move on out of the agenda. I was seeing if there were any other public comments that are non-COVID-19 related. I didn't see any hand raised, so I'll move on to, there's no new business. Approval of warrants and pending contracts, treasury warrants and pending contracts, including the one addition that we discussed earlier. Is there a motion?
So moved, Madam Chair.
Second.
Is there a second? Okay, all those in favor by Murphy?
Aye.
Matt Fee?
Aye.
Christy Farrington?
Aye.
Bridges?
Aye.
Okay, thank you. John Holgate, aye. Citizen departmental request. The Airport Commission, this is the request for the select board to declare an emergency in regard to the PFAS and to request that the Department of Revenue approve deficit spending by emergency. There is a motion.
Okay.
Oh, thank you. But I think that we do need to reference the motion that Erica sent. Jason, did you say you had it?
If you can please read it.
Yeah, do you want me to? I have it here.
Yeah.
Okay.
If you don't have Jason, you could second it. Thanks. Go ahead.
I move that the select board vote pursuant to General Law, Chapter 44, 3031 to declare a local emergency in order to address ongoing contamination at and adjacent to the Nantucket Memorial Airport caused by per and polyfluoral alkali substances, PFAS, which have been found in private drinking water wells adjacent to the airport, and to authorize the finance director to request authority from the Department of Revenue to deficit spend within the Airport Enterprise Fund the additional sum of $3,500,000 to be used to continue the airport's program of testing and installing individual treatment systems for private wells where the PFAS levels meet or exceed recommended levels, the extension of the town's public water supply to affect neighborhoods, and to conduct further risk assessments. It is the present intention of the Select Board that a borrowing authorization for these additional funds will be sought at the 2021 Spring Annual Town Meeting.
Is there a second? Melissa?
Yeah, second.
Okay, all those in favor by roll call vote. Matt Fee?
Aye.
Christy Ferrantella?
Aye.
Jason Bridges?
Aye.
Melissa Murray?
Aye.
Holgate, that passes unanimously. Next, we have Finance Department request for aviation bonds for the airport.
Thank you, Madam Chair. So last week, Hilltop Securities reached out to us. We have two airport bonds, a general obligation bond dated from 2011. Part of it is related to the terminal and some airport parking lot improvements that were made and financed with this bond that was issued in 2011. Hilltop is able to be called coming up by the end of the year. And as we typically do, we ask the Select Board for approval to move forward. As I did note in the AIS, the net present value projected budgetary savings right now is just a little over $700,000. Rates are extremely advantageous right now. So we would ask for your support to be able to move forward with pursuing this refunding opportunity to hopefully lower the airport's interest cost over the next 10 to 12 years of the remaining life of the debt.
Thank you. Is there a motion?
Move approval.
Second.
All those in favor by roll call. Matt Fee?
Aye.
Christy Ferrantella?
Aye.
Jason Bridges?
Aye.
Melissa Murphy?
Aye.
Holgate, aye. That passes unanimously.
Thank you.
Thank you, Brian. Next, we have the Department of Culture and Tourism request to schedule the 2021 Independence Day celebrations on July 3rd and the fireworks weather date of July 5th. Janet Schulte?
Thank you, Madam Chair. Good evening, everyone. July 4th next year falls on a Sunday, and traditionally the town has moved July 4th activities on Main Street to a different date when it falls on a Sunday so that people who are attending Sunday morning worship services have a place to park. The second matter affecting this recommendation is that the fireworks company has not been able to locate a barge for July 4th, 2021. And that's because when we moved off of the July 4th date, when we went to stopping the parties on the beaches, we fell out of the queue to be eligible for one. So the request is that we move everything to July 3rd. Atlas Pyrotechnics is able to schedule the fireworks for July 3rd with a rain date of the 5th. And we would seek to have your approval to do that. I think it would be good for visitors and residents to have everything on one date. It would feel like an Independence Day all in one, and that's the request. I've talked to the fire chief and the police chief, and they are both in support of this recommendation.
Just one question from me is, would we do the children's beach activities on Sunday evening?
We would do everything on the same day. We would do the Main Street activities on Saturday, the 3rd. We would do the children's beach activities. We'd have the staff do that. And then David and I would be present at the fireworks to make that call on the night of the 3rd.
Oh, okay. I thought that we had done an evening on the 4th when we didn't have the fireworks on the 4th at Children's Beach with some kind of a concert. No?
No, we would do that concert that night too, the same day.
Oh. Okay. How does everyone feel about that? Christy?
I'm comfortable with that, and I'd make a motion to move forward and approve July 3rd, 2021.
Jason, did you have a comment before we?
Yeah.
Did you want to?
Second, I just wanted to say what a good job that town departments and the police department and janitor, getting this to the point where we can have it all on one day. Right? We couldn't do that 3 or 4 years ago, or 2 years ago. So I second it.
Any comments before we go? Okay, all those in favor by roll call: Matt Fay,
Aye.
Chris,
Aye.
Jason Bridges,
Aye.
Melissa Murphy,
Aye.
John Holgate, aye.
Thank you.
Thank you, Janet. Next, we have Richmond Great Point Development, request to allow additional modular housing structures to be transported prior to September 15th over the road moratorium end date and to block off-street parking along Washington Street from Salem Street to Common Street due to over-wide units. I think Phil Paston, are you still on?
No, he seemed to have dropped off, but I don't know if this is him that is the call-in listener. I'm going to allow this person to talk and see if it's him.
It's me. Thank you for letting me speak. I got to move from the office to the airport, trying to get back to Hyannis. Can you hear me?
Yes.
Hello?
We can hear you.
Okay, great. So thank you for giving us the opportunity to speak tonight. Due to COVID-19, our manufacturer of our homes, or I should say homes and apartments for the affordables, has gone on break because of COVID-19 or backed up. When they were allowed to open up in Pennsylvania, not a lot of their workers had come back as they had planned, so they were delayed. So we are now asking for 4 more dates to bring our modules over to be able to keep to our schedule for the people who have already signed leases for our apartments. And I had sent in the dates that we're requesting. Phil Marks has agreed to have all trailers through the town of Nantucket no later than 7:15, but most likely by 7 a.m. on the following dates: August 18th, August 25th, and September 1, and September 10th. So we're asking if the Board of Selectmen would allow us to continue to do that so we can meet our schedule for our tenants.
Thank you, Phil. Erica?
I will just note that actually the over-the-road application and permitting does have a, I don't know if I want to call it a loophole, but moves are allowed up until 10 a.m. They have to be off the road at 10 a.m., but because these are over-wide structures, they require the blocking of parking along Washington Street because they're too wide to get through town. So that is one of the reasons why we brought it to you, because previously at our prior meeting, you all had said no more moves after July 20th, and we were going to wait until September 15th. So if you want to change that, that's fine, but I didn't feel comfortable signing off on blocking all that traffic without a vote from the board.
We definitely appreciate that. I mean, I think initially when we took that vote, that was the latest date that they'd requested, and we didn't want to open up new things, but it sounds like there were some delays. But what is the board thing? Melissa, you had your mic, or Christy?
Are all of these affordable units?
Each of them are in buildings that each building has affordable units in them. Per the planning board's direction, we couldn't put all the affordables in each building. This is our last building which has affordable units in it.
Thank you.
Matt?
Question, Jason, you're down there every day. How did it work?
There was one day that it was a little late, like 8:15, but that was because there was a mix-up with detail. But it wasn't, Richmond's issue. But since then, they're through. at least in front of me by 7:15. They're through, and the parking signs are up, and the parking's back by 7:15. So it's been really good.
Thanks, Jason. Matt?
Move approval?
Is there, okay, in favor by roll call, Matt Fay,
Aye.
Christy Ferrantella,
Aye.
Lisa Bridges,
Aye.
Melissa Murphy,
Aye.
Kate, aye. Thank you, Phil. Thank you, Erica.
Thank you very much.
Next up, we have some realists. We have the Affordable Housing Trust request for approval to partially fund Habitat for Humanity's construction of a duplex Beachgrass Road in Richmond Sandpiper Development. Christy?
I have a question for John Giorgio. I was previously employed by Habitat, so I wasn't sure if I should abstain from this. It's been 10, almost 11 months since I was employed by them.
So you no longer have any employment relationship. No, I think it's fine to participate, Christy.
Okay, thank you.
Sorry, you have somebody listed as Colin in your group, and I don't know who that is.
Whoever is Colin, could you identify yourself?
They're muted too.
Who's that?
Who is
Hi.
that?
Erica, it's Brian Swain. I'm here to monitor my yard sale parcels.
Okay, thank you.
Comments? Richard Hussey?
Tucker, chime in if you can. This is a request to partially fund our next project. It's a modular duplex in the Richmond Sandpiper 1 development. With the total cost is going to be roughly $660,000. We're asking for approval of the AHTF ask of $460,000 to fund this home. It's a duplex. It's our 12th and 13th families that we've housed since we started building in 2004. And before Matt asks the question, this is the last time anyone from Habitat will be before this group looking for assistance. Everything going forward is going to be shy listed. We worked very hard trying to see if we could get some of our prior units shy listed, and it turned out to be a mission impossible. We primarily failed on two accounts. We didn't advertise off island and for 60 days. And the other thing was we did not hire a licensed administrator to conduct our lottery. We were unaware of those requirements, but rest assured going forward, we've got our house in order, and everything going forward will be shy listed.
I really appreciate, I'm sure we all do, the work that you've put into figuring out how to do that. Do you have anything to add, or should we just go to a vote?
I mean, this is a continuation of what you all had approved in conjunction at your February 19th meeting, the duplex lot, to allow this project to happen and clear the way for the future shy listed units, as Rich just spoke about. So we're hoping that you will approve this tonight, and the amount is consistent with grants that we've made to other housing organizations in terms of a per unit price.
Thank you. Any board questions or a motion? Matt?
Move.
Is there a second?
Yeah, I'll second that.
Thank you, Melissa. All those in favor by roll call, Matt Fay?
Aye.
Christy Ferrantella?
Aye.
Lisa Bridges?
Aye.
Melissa Murphy?
Aye.
John Holgate, aye. That passes unanimously.
Thank you.
Thank you so much.
Okay, next up, we have request for approval and execution of purchase and sale agreement. This is for unnamed parcel, and Elm Street is shown on plan of land.
Yes, good afternoon, Madam Chair.
Sorry, Ken, I was trying to shorten the whole agenda item, but you can discuss it.
All right. I'm going to give you a bit of background, and the background applies equally to the three parcels that are up for consideration, but there will need to be separate votes with respect to each of the parcels. For those of you who may not remember, this has been reviewed and approved twice by the Real Estate Assessment Committee following the state-defined RFP process that was dealing with these parcels, which were first approved at town meeting in 2009 for both their acquisition and disposition. The town took these parcels with no consideration being paid to the owners. The owners at that time, in discussions with the town, agreed to create at their own expense all the plans necessary for what needed to be done as authorized at town meeting. The three parcels were awarded as pursuant to the RFP process to the highest bidders. In each case, it was the abutter of each of the parcels that was awarded the bid. As a part of the process, the Real Estate Assessment Committee reviews the developmental and the environmental impacts of the properties, including the fact of their location with respect to the dunes. When this matter was last discussed back in February and in early March, Matt had asked a question with respect to the potential impact on these properties relative to coastal resiliency and or erosion. And what's happened is that in the meantime, I've had the opportunity to meet with Vincent Murphy, who is the Coastal Resilience Coordinator. And after his doing a significant amount of research based on the best evidence available late this afternoon, he sent me an email, and I will read the two relevant parts of the email to you. And it says, the elevations for these parcels is generally around 14 feet. The reference to the CRAC recommendation is mainly in relation to coastal flooding, not erosion. Though the CRAC recommendation has not been accepted as of this time with the Select Board, these elevations put it beyond the potential flood area that the NOAA high scenario for the year 2100 that the CRAC is recommending to the Select Board. He then goes on to say, that leaves the question of erosion. The current best source for erosion data is the state MORIS, Massachusetts Ocean Resource Information System mapping system. That mapping system shows that in the 8 survey timeframes from 1844 to 2009, the last date of the map surveys, that this area was generally accreting, not eroding. It was generally gaining from 0.75 to 1.28 feet per year. So based on the report from the Coastal Resilience Coordinator, I think that addresses the concerns that were raised by Matt and others relative to the compliance with the issues that we look at from the town from a coastal resiliency point of view, and also from the erosion point of view. And as a result, it is my recommendation that the Select Board move forward to proceed forward with the disposition of these three properties by separate motions for the amounts indicated in the AIS. Each of these parcels provide for additional revenue to the town and go onto the tax base. The other thing that is important to, I think that the town should be aware of, in view of the fact that no consideration was paid by the town to them at the time it was acquired, should this not proceed forward, the town would be exposed to potential litigation with respect to damages for the taking of their property at no cost. So my recommendation is to move forward as recommended with respect to each of these properties so that we get this matter settled and move forward. Thank you.
So this is for items 2, 3, and 4, which
that is correct. Yes.
Separate motions, but are there board questions or comments on item number 2 or a motion? Matt?
Just a comment. Reading through the descriptions, What happens when we go to town meet? I think we need a real look at that. We need an eagle. I know this will vote pass tonight, and it's fine. I think eagle eye look at this before we go to town meeting, before we make, sort of deals and agreements with people. We should decide whether we want something like the old road bed to be a bike trail or to be something else. If we're near the ocean, we should be thinking of it before. What happens in this process is whenever anyone has a concern and brings it up, they're told, don't worry. The selectmen will take care of it for you. When it gets to their level, they'll control, they'll take care of it. And then when it gets to us, what we're told is it was a vote at town meeting. It's already done. We can't do it. We can't undo it because all these expectations are built in. We'll have to pay a bunch of money. So we've got a broken process. I'm going to abstain on these. I'm not going to oppose them. I don't know if I agree with Vince because I think the storm tide pathways on the higher end are out there. I'm not going to fight that. I'm going to abstain, but I plead with us to improve the process so we're not stuck with only one option at the end.
Are there any other board comments or questions? Any motions?
I'll make a motion to approve.
Is there a second? Okay. All those in favor by roll call, Matt Fee,
Abstain.
Christy Ferrantella,
Aye.
Melissa Murphy,
Aye.
Jason Bridges, John Holgate, aye. That's 4-0 vote. On number 2, on to number 3. Is there a motion?
Move approval.
Motion. Second.
All those in favor by roll call, Matt Fee,
Abstain.
Christy Ferrantella,
Aye.
Melissa Murphy,
Aye.
Jason Bridges,
Aye.
John Holgate, aye. Item number 4.
Motion to approve.
Second.
All those in favor by roll call, Matt Fee,
Abstain.
Christy Ferrantella,
Aye.
Melissa Murphy,
Aye.
Jason Bridges,
Aye.
John Holgate, aye. And I do agree that we do need to identify much earlier in the process that if there are parcels throughout the island or groups of parcels throughout the island that the board wants to consider taking for municipal uses.
And another comment is we asked, geez, could we put one big beach on there? Because eventually it's going to erode. No, you can't do that because you've already got a deal in place. So, there's issues that, need to be brought up earlier in the process. And I hope we find a way to do that.
Matt, understood. I just wanted to say that with respect to these particular parcels, one big beach would probably not make much sense because, in fact, the town owns the beach, right? That abut each of these 3 parcels all the way out to the ocean.
I understand that. Eventually, we won't.
Okay. Next, town manager's report is empty tonight. But I know Libby has things to say under our select board reports and comments. Discussion of a potential scheduling for fall special town meeting, and then determination of ballot questions. There is kind of some new information about funding that may not necessitate a fall town meeting that Libby can discuss.
Yep, I think Brian and maybe John could help with this. We had initially had some discussion about the possibility of a borrowing authorization for the airport for the PFAS issue and possibly the town. However, we believe that those can be handled at least on an interim basis through something like what you did tonight already, and asking the Department of Revenue for additional approvals for deficit spending and or borrowing. I think, Brian, I might not be saying that totally correctly, but we can have any other action that we needed done at town meeting. In annual town meeting for 2021. Is that about right, Brian? For the
that's correct. We wouldn't need a special town meeting to deal with for the airport. Once we get the approval from DOR, if we needed more than the $3.5 million, John and I actually talked about it earlier, we would simply ask for additional authorization, and that borrowing authorization could take place at the annual town meeting.
Okay, thank you for that. And with respect to another item, we had been talking a little bit about the island home and seeing if there was any way to continue the process of funding that on a more permanent basis through a confirmatory vote or a putting forward a vote at town meeting, following up on the ballot question. However, we have already adjusted the budget for fiscal 2021, and it's tight, but it's not necessarily a specific issue. There may be some things that can be adjusted at the annual town meeting. We will have to redo that ballot question in all likelihood. But there are some other overriding issues potentially with a special town meeting in the fall. First of all, there are definitely logistical issues with technology, sanitization, and timing at the school. We had a meeting earlier this week with the school facilities director, Diane O'Neill, who is here, the town clerk, Nancy Holmes, and the chief technology officer, Karen McGonigal, and I know the moderator is on as well. The logistics are going to be difficult because most likely there will be some school in session by, say, the end of September. And side note, I gave you a couple of timelines for September 19th and September 26th. September 19th would be out anyway. That's a religious holiday issue. So we would be looking at Saturday, September 26th. And that, because of the COVID setup requirements, we would have to start setting up on Friday. That's going to be problematic with potentially kids in the school on Friday. And then that leaves us cleaning, setting up all of the technology, not really a lot of time to test it out. And then say we were done, at some point on Saturday, now that all has to be cleaned up, and there has to be at least 24 hours of sanitization before school starts again, presumably on Monday. We also have the issue of potential citizen petitions. There are the 22 petitions that were carried over from the annual. Are those people all going to want their petitions, or maybe even some of them, heard at the special? Setting the warrant for the special will necessitate that people will have the opportunity to submit additional articles, potentially. There is a quorum issue with the island home or the airport. There's a 5% quorum for appropriations for special town meetings locally. And while there is legislation that allows relaxation of quorum requirements to no less than, John, correct me if I'm wrong, 10% of what the established quorum is, that would be approximately 46 people. And just in talking about it internally, we think that could be problematic for the voters. If, obviously more than that could show up, and obviously we have to set up for more than that. And it's a lot. That's not to say it's not doable. It is doable, but the logistics are rather daunting. And then there's just the overall safety issue. Are people going to feel safe in a room for however many hours, even social distanced? The June 25th town meeting was very quick, but this could be, especially if we had the island home on there, lengthy. So I think if we can put it off and just go with the annual at 2021, that might be a better approach at this point.
Does anybody have questions or comments? Jason?
At first, I really wanted to find a way to have a meeting in the fall. But the more we talked about it, with potentially more citizen warrant articles coming on, and we don't know what September is going to look like. That's not that far away. We don't know if we're in the clear or it's heading that direction. It's going to put a little more work on into next spring, but hopefully we have it'll be a little better by then, and we can deal with it then. There's also an opportunity cost of trying to turn this around really, really fast. It's 2 months away. With everything we saw tonight, we talked for an hour, 40 minutes about COVID, putting all this on town staff, it's another issue when we don't really need to do it. So those are my thoughts. I started with, we got to find a way to do it. Now I'm kind of leaning towards, let's push it to the spring.
One last thing about the timing. There is, reportedly, a lot of people did not get their warrants for the special. And because this is already, as Jason said, September's right around the corner, it's already very tight timing-wise with the timelines that I did work to develop. And there's things are not normal right now with mail delivery and a lot of other things. So it just makes everything twice as difficult. And I would no way guarantee that people would get their warrants before town meeting, which is just another issue.
Matt?
Yeah, looking at it and looking at the dates, I just think there's no way that we could, we could be pulling this off. I just think it's too close. There's too many other priorities. I just think going to the spring is a great idea and a great recommendation by Libby.
Christy?
I just want to echo what Matt and Jason have already said is I think if there's not an immediate need for it, then it's okay to wait till the spring.
Melissa?
Thank you. I also agree. I think that my biggest concern is public access to participating in government. And I think that would be severely limited. And during the annual town meeting that got pushed back, we had to make those exceptions. And I think the community gave us a lot of leeway and latitude to do what we needed to do to be productive and remain productive. This seems optional and not in the best interest. And I really hope that we can think about if we're still under some kind of COVID protocols, even in the spring of 2021, how we improve access to people to town meeting. And I think that's something we can certainly take time to work on over the next 6 months. So I would support Libby's recommendation.
Yes, I agree. I was concerned that we were going to need to have a meeting for PFAS borrowing. And I was concerned about not finalizing the island home funding. But in light of everything that's been said, I think that this makes sense and we can do a lot more planning for it and work on moving some other initiatives forward. I don't know if anyway, Sarah, did you have anything you wanted to say or? Do you need a vote from us? I think that's just a consensus that we're not going to have one. And I would assume that we will also not have any ballot questions unless people want to talk about that further. We need to make a decision actually tonight if we're going to have any ballot questions.
Maybe just to refresh everybody's memory about the ballot question, I know it's in your packet, but there were 3 questions that failed at the annual town election. Question 2, which was the debt exclusion for Newtown Road, transportation improvements for 1.1 million. Question 3 was a debt exclusion for the reconstruction of Lovers Lane, 3.2 million. And question 4, a debt exclusion for improvements to Amelia Drive and Waite Drive of 3.7 million. So those will need, if we are going to proceed with them, ballot votes and town meeting votes. So just FYI. And there had been some early discussion about potentially getting them on the November ballot, which, as the chair noted, that decision does need to be made because we have to we have to request the Secretary of State's office if we're going to put them on for November. So we need to know one way or the other.
I wouldn't be opposed to bringing those back up, but I'm not sure that the community appetite is there. Jason?
What's the difference between what's the advantage of putting them on in November when we could also be putting them in, a week or 2 after our spring town meeting, and where it's a little more connected to the articles?
Yes, exactly. I'm not so sure there is much of an advantage to put them on the November ballot because we have to be very careful how we talk about them and try to sell them, for example, because of campaign finance laws or election finance issues. And we won't, typically, as we all know, we have a town meeting before the election. So we talk about all of this there. And then it's fresh in people's minds to vote on at the ballot the week or two later. But we won't have that here.
Christy, then Melissa.
I think the only benefit would have been the voter turnout for a November national election. But given that we won't have discussions at a town meeting, I think that these could wait till spring. And I think there's also opportunities to think creatively about these if there's any other solutions other than an override.
Melissa?
Thank you. Yes, I agree with you, Christy. I think that how narrowly some of these failed is likely because we didn't have the benefit of town meeting discussion. And I'd hate to see them put forward a second time again without that benefit of community conversation. So I'm in support of waiting until we have a proper town meeting. They can be debated and discussed, and then a ballot vote.
Okay, it sounds like there's consensus on that. During the Civic League meeting that Libby and I attended on Saturday, I will just note that some of the Surfside residents did speak about Lover's Lane and concerns with that not passing and not passing the previous broader set of streets. And they feel like we haven't sold it to the community. So I think not having the town meeting discussion would again be not being able to sort of get the word out on why it's important. And I did ask them just to see what their thoughts were on whether they thought betterments could ever be a potential to get those funded. And they did not think that that would be well received by the Surfside residents. That's one of our only other mechanisms to get that kind of money appropriated.
We asked for you, Matt.
Well, thank you for asking. If you give me a choice, I'd never want the betterment. But if but at the same time, if that is what is necessary in this economic climate to, pay $100 a year for 20 years or some low number, I think it may be a option for them, and it should be presented to them in that manner. I think the roads out there really need it. I think they need to be fixed. And I think we're going to have a tough time coming off what we're having, getting people to vote for some of these things because people are, it worked wonders for the bike path out to Cisco and out to, that whole area. And it's worked in a couple other areas. So we'll see.
It could be worthwhile to run some numbers on how many residences would contribute and what the actual dollar figures would be.
And I know I'm not popular in Surfside for talking about this, but.
Okay, so I think we have consensus on that. Item number 3 is a continued discussion update as to racial equity, race relations task force and community forum. I think Rachel just has a few very brief comments.
Yes, thank you. Good evening. I am just going to mention, thank you, Don, for mentioning this last week, but the diversity, equity, inclusion position has been posted. It is on the town website under the Human Resources tab. It is also on local town bulletin boards in the offices, and it will be in the INM, I believe, this week. We're also doing a little bit more far-reaching advertising of this position. So we're also utilizing the Cape Cod Times. I believe it's a 7-day print and 30-day online, and there's about 6 or 7 online sites that includes as part of their diversity network. So that is a great ability to reach a little bit more of candidates than just advertising locally. The application deadline is August 10th at 4 p.m. and people can either apply online through the Human Resources or the Employment Opportunities tab, or they can send a cover letter, resume, and application to the email hr@nantucket-ma.gov. And I just want to tie this back to the statement that you all finalized on June 24th, that is one of the critical action items out of 5 that you identified at the bottom of that, which was to create the DEI office. So we are working on that. 2 of the other items are ongoing. They involve the request for proposals that we are still reviewing and finalizing. And that would be the development of the strategic plan that also reviews our current practices and policies in town, as well as professional development and staff training. And then the last 2 are the ones that are a little bit more in process than the other 3. And that relates to development of a diversity advisory board, as well as a system for community members and staff to report incidents that they incur. And so there's been a couple avenues that we have been working around to see how to tackle these. Obviously, the Council for Human Services is one. Having the employee empowerment team. And then we've also looked at a few other avenues to be identified. Last week, I know you had a great presentation from NEA, which was the community group that's been developed, and there might be some great way to collaborate with them. And I just wanted to make note that I have gotten some great feedback about that presentation and the development of that group and the work that they're doing, and how the town can maybe tie into that or benefit from that without actually being the one to do things such as a community forum. And I really appreciate getting the feedback, because it's very helpful to know where people are really looking that we want to be of assistance to or not. And I think the reason why I want to make note of this is that there has been some individuals who have noted that they want to participate, but they're a little reluctant. They're not sure how to participate, how exactly to comment. They're not comfortable coming on the select board meeting in this type of a capacity. And so there's like a fear of either being pressured or judged, which needs to be respected. And so if we can also utilize the NEA group or a community forum or any avenue that they develop that might create a safer place for people who are trying to have these difficult conversations or trying to say things that make them feel vulnerable, feel more comfortable saying, then we really want to try and encourage that and tap into that. So I just wanted to make note of that. And that is about all I have for an update this week.
Thank you very much. So anything from the board? Okay. I'm going to skip over committee reports so that we can get to the HDC appeal. And I will move into opening the public hearing for that appeal. And I believe I will turn it over to Steve Cohen.
Hi, Madam Chair. Stephen Cohen for the appellant. I want to thank the Commission for the board for all of its hard work tonight on some important public health issues. I'm sure you're tired, and I'll try to keep this brief. I think you've seen the very thick packets that were submitted. There were 2 HTC processes, and it produced a couple inches of paper, and it probably was not that clear to you reviewing that what was actually going on. So I'll try to say the one thing that we can skip is the design issue, and what I mean by that is that the house my client wants to build is identical to the house that was approved by the HDC. So there's no dispute now about what the house should look like. The issue that we do have is that the HDC was provided with 2 applications. One was for a demolition and one was for the construction of a new house. And I think it handled both of those, unfortunately, inappropriately, without making the proper findings and without acting within its jurisdiction. And I think that that is one area where the Commission, where the Select Board has historically overturned or remanded to the HDC where there are matters of process and jurisdiction. So I want to try to focus on that, and I'm not asking you to make any design decisions. So the original application asked to demolish this house at 6 Magnolia, and we submitted quite a bit of information to show that it was not historic or historically important. One of the key pieces of information is that the HDC's own historic survey says that there is no known information about the architectural or historic significance of this structure, and there is no evidence provided into the record about that. there's also significant information that was submitted to the record to show that if there's any historic structure fabric left to the structure, that there's very, very little of it, and it's not historically important. And what I mean by that is that there was originally a structure on this lot in the early 1800s, and then by the late 1800s, by the 1898 Sambor map, the lot is shown as vacant. So that structure disappeared. And then sometime after that, in the early 1900s, a small structure appears in the Sambor maps at the rear of the structure, at the rear of the lot, I'm sorry. And then in the 1923, there's a move to take that structure, most likely that structure, and to move it forward and to add onto it and to convert it more into a small but modern dwelling. And that structure, if it still existed, would not necessarily be historically important enough to save, but very little of it is left. If you go through the evidence that was submitted, it shows that the 1923 structure was then altered. It had a small addition, a one-story addition on the back and a porch on the side. And that later, that in the 1938, there's a central dormer that is in the 50s and replaced by the two existing dormers that are there now on either side, and the central dormer is removed. And then in the 50s and the 70s, there's a large addition onto the back of the house that essentially eliminates the entire rear of the house, the roof and the back of the structure, and replaces it with a two-story structure. So the potential, most or all of that old structure was likely destroyed in the changes in the 50s and 70s, where the one-story structure was replaced by the two-story structure, and the dormers were swapped out from the single in the center to the double on either side. So what you wind up with is the only potentially old portion of the building is the front half of the roof and the front half of the facade of the front portion of the building. All of the back of the original portion of the building was replaced, and all of the back of the existing structure dates back to the 1970s. If you look inside the existing front portion of the structure, you can see that there's some old wood, but also a significant amount of milled wood, which means that it's from modern times. It's not hand-sewn wood. It's modern milled wood. It might be 30, 40, 50 years old, but it's not historic fabric. So that means that most or all of the structure, here you can see in this plan, essentially everything that's yellow is modern, and only what's white is potentially new. But if you look at it's potentially old. Small portion of the roof, although even here it shows more as old than is likely accurate, because the back half of that gambrel roof was cut into when the addition was put on. So you're really just talking about pieces of that roof. And then again, if you look at the two dormers on the front, there used to be a single dormer there. So that means that everything behind where the single dormer was is new, and the double dormers are new. So that roof is not intact. And then the areas where I said that there was evidence of modern milled wood is in the lower level. So there's really no old portion of this building that hasn't been adulterated in that way. Nor is there any evidence that anything that might be old is significant, right? It's not really just a matter of old, and the commission says it all the time, it's not the age of the building, it's whether or not it's historically significant. And in order to deny a demolition, the commission has to make a finding that it's against the public interest because of historic significance, not just based on age. And that there's no evidence about that, and there's no finding about that. So that's the first thing, is that the request for a demolition that was approved as a partial demolition instead of full demolition is really a denial of a demolition without a proper finding and without any basis for that finding. Then if we move to the second permit, which is the approval of the actual design, there's no question about the design, but there seems to be a very strange discussion in the minutes and notes on the approval that suggest that the commission wants the half of the facade of the structure to essentially be floated in midair and retained on the property, even though the back half of the building is being cut off, even though portions of that building are being removed, and even though it's getting a new foundation and moving to a new location. There seems to be unclear requirements as to what that structure should be, essentially floated in some way on site and retained, not disassembled. So that is both beyond the commission's authority. It doesn't have the jurisdiction to make those kind of requirements. It doesn't have the authority to make those kind of requirements. It's also unsafe. It's also it serves no purpose. And it's against the commission's practice. The commission has on many occasions required people to save historic fabric, either windows or wood or doors or whatever. But it's generally disassembled, numbered, cataloged, and then reused. And my client is 100% willing to do that. So in other words, my client is willing to save the historic fabric and reuse it, and he's willing to build the design that was approved as is. But there has to be some reason here, and the HDC should be operating within its jurisdiction, not essentially within its fears of complaining abutters if the building disappeared, that there would be an uproar, and that's not how it should be making decisions. And I think that this decision was made more out of fear of neighbors complaining was within its jurisdiction. So I would ask the board to reverse the HDC's decision, or to remand the HDC's decision back to the HDC to make findings and determinations consistent with approving what I just said. And I'm happy to answer questions. And Linda Williams is on the line, who has quite a bit done a lot of research and had all the details on this. But I think, the less we can get into, exploring the history, and more we could stick to the questions at hand, is probably a better use of time. Thank you.
Okay, so if there's nothing else to add right now, then I'll go to the Historic District Commission.
Dawn, did you want me to finish the argument for my client?
Well, Steve just said that he thought you could hold your comments. Do you have a couple of comments to make?
Yeah, just a couple of quick comments. I did spend a lot of time researching every piece of this building, and I felt it was unreasonable in this particular case, not in general of taking buildings away and bringing them back, but in this particular case, because there are so few intact pieces of this structure left after it had been altered multiple times since it was the small shack was put on the back of the lot years ago and moved around again. And one of the things that was concerning, I believe there was an engineer's letter in the packet of trying to keep these pieces, especially a second floor gable piece that's not attached to a first floor anything, as you can see by the demo plan, intact on the site, supported by something in midair, when all the rest of the things that are supporting the front facade and those gable ends is gone, because they approved a lot of additions and some changes to this structure in the other approval, as Steve mentioned. How are you going to do that when the foundation itself is being dug underneath it? There's nothing for them to sit on. And the new foundation is several feet forward of that, because the whole building is moving forward. The whole site of the building is moving forward. How are we supposed to keep these free-floating pieces on site? As Steve mentioned, we suggested that we would be able to take those pieces off-site, store them, bring them back, and sister them back into the new structure, pretty much where they are right now, because they're integrated into the approved design. So we are asking you to overturn the HDC and allow us to remove it and bring it back, or remand it so we can work that detail out. But basically, this has happened before in the HDC on my time there, where we were told, I believe by Attorney Pucci, that we should not be dictating how things are built, what the process is supposed to be when you do this under an approved design. So I'm having trouble with them telling us how to keep something floating in midair when it doesn't have any support structure left, while we have a new hole being dug underneath those pieces, no deck, because you have to dig the hole with no deck, where are these pieces supposed to stay? There isn't enough room on the property to actually keep them on the property safely without running the risk of damaging them. We'd like to take them off. If they insist upon not allowing us to demolish and rebuild the structure as we are approved, then let us remove them from the site, store them, and then bring them back. So that's what really we're after.
Thank you, Lenny. I'll turn it over to the HGC now to define their position.
Yes, this is Kathy Flynn. I just wanted to say that the board reviewed the applications over 3 meetings, and they really took all the historical information into account. They felt very strongly that the front portion of the house, of course, was historic, more of the documentation that was provided. At the end, the last meeting, the board approved saving the sides of the front structure, nothing hanging in air. It was to brace it, lift it up, put a foundation, and put it back down again, which is done quite often. It's actually was more of a method. They were offering solutions to keep the structure instead of dismantling it and bringing it back. That would be considered a demo and a rebuild. So.
Thank you, Kathy.
Oh, you're welcome.
Dawn, should I go next?
Yes, Ray, go ahead.
Okay, I'd like to go, and then Val Oliver would also like to speak, I think. I think she's on the line.
Yes, thanks.
So I have a few notes. One, this idea of, retaining a portion of the building that this is never done. As an architect, I've worked on dozens and dozens and dozens of projects where we have saved portions of a historic building. I've done so on half the houses on Lincoln Circle. My wife just finished one in Sconset on Main Street. We do them all over the place. So and that's at the HDC's wish. And so we save the historic portions of the building. And indeed, we have Toscana come in and shore up the historic pieces of the building. They lift them up, they put them on cribbing, we excavate underneath. This is all a process that's done dozens and dozens of times every year by lots of different people. So it's not something that we've just sort of conceived. And how, I just want to make the point that we were very uncomfortable to the point where we did not approve a demolition of this portion of the building because we did all feel that this was a historic piece that was worthy of saving. How the applicant and their builder actually decides to do that is up to them. However, when we get into this idea of dismantling a building, taking the pieces apart, taking them off-site, that's a demolition. It doesn't matter if it goes back together. I would also say, if it does go back together, who's there to police for the benefit of the HEC? Who's there to police that it's actually going back together the same way that it came apart? So, in order to make sure that everything's done the way it's supposed to be done, the building is shored up in place. The excavation goes underneath the house. It's done all the time. So I take issue with the fact that this is a brand new thing that the HTC just conceived. Let's see. We obviously didn't require the whole house to be retained. There are portions, as Stephen Cohen pointed out, that were not historic. So we allowed those to go. But the pieces, or the piece that we felt was really contributing, and when I use the word contributing or significant, it's based on its scale with respect to its neighbors in Sconset, its style. It's a very, very unique style that we wanted to see preserved. So yeah, we were asking for this 1923 front half of the building to be retained. And as I say, I don't believe that was an unreasonable request given the age and the significance of that facade. So that's why the board did not vote in favor of the demolition of this project. And I will take questions if you have any. Val, you want to say?
Should I go?
Yes,
sure.
please.
Okay. So I agree with what's been said by Ray and Kathy, and I'd just like to make a couple of statements. Preserving historic buildings is crucial to retaining this island's heritage and history, as we know. There was an approval granted to the applicant to allow significant changes to this structure, and our request was to maintain the original front mass that was thought to be the original mass, and I thought that was more than reasonable. The 75% of this structure was blessed to go away. This message was not unclear, Mr. Cohen. I'm sorry that it was foggy for you, but in every single minutes you can see, we were quite clear. We were asking the front barn type structure, house, barn, or Levi Starbucks igloo, which someone from the NHA sent to us, could have been this structure, was to remain. And quite frankly, if we start to allow people to take things apart and rebuild them, or demo and rebuild them exactly the same, we may as well be Disneyland. The structure, as Ray said, can be held together and braced up and a new foundation put under it. We've all done that before in town as we're trying to save our historic structures. Nantucket is, in its totality, a National Historic Landmark, and it's paramount that we retain the best of our architectural heritage and work to preserve its quality and our beautiful streetscapes, which is part of our sense of place. These streetscapes tell the story of Nantucket and its bygone era. If we allow demolition with the promise of authentic reconstruction because it's easier and more cost effective, we will lose the soul of our island and the tear down epidemic will consume us. Thank you.
Thank you, Val. This is when rebuttals can follow from the appellant.
Sure. Thank you, Don. Madam Chair, I think I agree with, my friends Val and Ray in general. I just don't agree with the applicability of what they said here. It is common for a structure to be saved, but the idea that we're saving, and set aside on the lot. But here you're talking about the front facade and a tiny portion of the roof, and it seemed to be that it had to be saved, and I'm happy to be corrected on this, but not only saved on site, but saved in its current location where the new I've never seen a 1/3 of a building retained floating under a new foundation that's being installed. That, it's totally different than having a historic piece of a building that's really a structure that can be set aside on cribbing. This structure could not be, this piece that's being retained could not be set aside on cribbing. You'd essentially have to build a whole new house to hold it up. And then I don't know how you'd float it over the new foundation. So I'm not sure that, I'm not suggesting that retaining on site is a new methodology. I'm suggesting that it doesn't really apply here because there's such a small portion of the building that's historic and being retained. I also think that the board has not made its proper findings to deny demolition, and I think it's overly dictating the process here. And again, my client is willing to let go on the demolition issue and reuse the historic fabric that does currently exist here. However, that should be done by other tools that the HDC has used in the past, which is to require benchmarks and inspections at various points where cataloging could be done. I agree, they shouldn't just have to have it done willy-nilly, but the HDC has required that at various points in the process that cataloging is done and inspections are done so that you don't have to wait till the end and then it's too late. And that kind of a process could easily put in place without essentially requiring 1/3 of a house to be suspended over the construction of a new foundation for some indeterminable period of time. It's not safe. It's not about expense. It's not justified. Those findings have not been made. So I would encourage the select board to remand this case back to the HDC for approval of the existing design consistent with procedures that would enable for the tracking and reuse of the historic fabric here without being overly controlling of the process or creating an unsafe situation. Thank you.
Are there any?
Yeah, I'm raising my hand, but you can't see me raising my hand.
Go ahead. I'll go to you.
I agree with what everybody has said. I agree with what Val has said in principle and what Ray has said in principle, but the houses that have been involved with lifting over the last 37 years have had 4 walls.
Maybe we should have made the 4 walls.
Madam Chairman, I'm still talking. And it had 4 walls, and we're a little bit more stable because we were able to lift them up on cribbing. We do it, as Ray said, we do it all the time. It comes in all the time, new foundations under these older structures, particularly in the old historic district. This doesn't have 4 walls. It hasn't had 4 walls since they put that abomination on the back of it 30 some odd years ago. So they ripped off the last half of the roof. They ripped off some of the sides. They ripped off the whole rear wall. So when we take that stuff off, we still have to look at the east wall, which doesn't have a first floor. It was approved to be removed because I believe there's a bump out going there. So we're talking a second floor gable, which has already been compromised because the roof was removed. And we're talking about various other pieces. We have no problem putting the front back and putting those back and documenting the death out of this thing, and having people and Kathy come out and have a viewing as we move along through the process to make sure the front facade came back in and those 2 gable pieces came back in. We have no problem doing that. But to do it with those pieces suspended on this very narrow site is dangerous, number one. Number two, it doesn't serve a purpose if we're going to bring them back, but save them in a secure location under wraps, et cetera, to bring them back. That's all we're asking. We're not asking to demolish the structure or the pieces of the structure that are left. So this is just what we're asking to do. Either have you overturn them on this one issue or remand it. And I think maybe a remand, we can just work out the details of how the structure is going to get maintained and how we're going to construct it, which really is beyond the HDC's jurisdiction, according to Attorney Pucci. So I don't want to debate the demo or not demo. We're taking that off the table, but I want to be able to do what we need to do safely and bring it back safely.
Okay.
Yes, can you hear me?
Yes.
Yeah, there's someone vacuuming in the office here. I just wanted to clarify something that the chair mentioned the original roof is already almost gone and can't be saved. That was in the minutes from the final meeting. And the motion for the demolition was to save the 3 historical sides of the structure, not the roof. So I just wanted to make that clarification.
Thank you. Are there any public comments? Anyone wishing to speak on this? I don't see any hands raised. I have a question, if I could, and then I'll go to you, Matt. George, is there any reason why they couldn't just go back to the HDC to try and work out this detail as they describe? Why wouldn't they submit a new application with and outline a different process?
Right. Good evening, Madam Chair, members of the board. George Pucci from Town Council's office. Yes, they absolutely could go back. It's not like a zoning situation where, you have one crack at it and have to wait a period or something like that. They can come back early and often, file a new application. They don't have to go forward with the approval.
Can't hear him.
But I think you answered my question. Matt?
Can you not hear me? This is for Linda or Steve. The parts that you're bringing back, are you planning to insulate those from the interior or from the exterior?
They would probably have to be done construction from the interior, whether it's closed cell or some other thing, or we have to sister in those front things to get a 2x6. I have to talk to Paul Murphy about that. There are some exemptions available to historic structures, but we would probably have to do it from the interior to sister it back into a 2x6 construction, which is going to be required for the rest of the structure.
Ray, did you have something you wanted to add?
Me?
Yes, Ray, you were waving.
Yeah. Okay, so that's a very interesting point here. So Matt, I don't know quite where you were going with that, but one thing that should be mentioned is if a historic building is preserved, or a portion of a historic building is preserved, it is entitled to certain exemptions, and one of those exemptions is the insulation. So if you have an old building that has a 2x4 wall, it does not need to be sort of fluffed out to a 2x6 wall so that they can get the code amount of insulation in there. So this is actually one of the benefits of keeping intact the old portion of the building. So if you have an old staircase, for example, that doesn't meet code, if the staircase is intact, you keep it there and it doesn't meet code, the building inspector will say that that is grandfathered. Now, if the stair comes out, that means that the new stair that goes in has to meet code in every single way. Similarly, here, if the building goes away, if it's dismantled and then reconstructed, the building inspector is going to say, well, this is new construction, so it has to meet all of the current codes, has to meet all the energy codes, has to meet all the structural codes, safety codes, everything. So there's a pretty big distinction between leaving the piece or pieces of the building intact and taking them down. So I don't know whether that has anything to do with where you were going with the insulation, but just wanted to say that.
I'm not entirely sure about that, only because of a conversation I had with Paul today, and we've been talking about this for a couple of days.
Jump in, Linda. You've got. Why don't you turn your camera on?
No.
Other people have their hands raised, Matt.
I was coming that I've done a couple renovations, and I've wanted to keep sort of the interior, some of the 150-year-old ceiling. And so I've insulated from the outside, to keep that. It seemed like a shame to me to have that part that had the history be gone. So I chose to keep the point, and it was a pretty rough building, and I kept the parts that were, savable. That's why I was asking, because in a way I see some of the things that happen sometimes, and all the old stuff is just buried behind the new sheetrock, and it's not really, and I know it's not the jurisdiction of the HDC. I'm not going there, but it was just more informational to understand what the process with this house would be. Can
I close the public hearing, or is there any further discussion or question?
I do have one comment. My hand's raised somehow. It's the reason why we didn't go back is because we had to preserve. You only have 10 days under the current act. We haven't changed it yet, but under the current special act of the state, you only have 10 days to appeal a decision. So we had to preserve the client's rights by appealing the decision. Otherwise, there was no time to go back again to ask for a revision to how we were going to do this. So that's why it was not gone back yet. If you remand it, obviously we go back and we have the conversation. That's one way to get it back there.
Stephen?
Sure. I think the other reason why we haven't gone back is I think that there needs to be some significant clarification from town council as to what level of process the HDC can require. And I don't want to just go back to them and say, hey, we'd like to ask you the same question over and over like a 10-year-old. If they think that they can do something, they're not necessarily going to change it. And we think that they exceeded their authority. So we'd like some clarification on that. And I think that would be helpful in determining going forward, not just for this, but for other important historic projects. Thank you.
George Pucci, would you like to address that question?
Yes, can you hear me?
Yes, you're much better now.
Great. Would you stop me if I start to garble, and I'll move to a different place. So anyway, good evening, Madam Chair and members of the board. It's good to be with you tonight. George Pucci from Town Council's office. First of all, to clarify my answer to your question before, yes, they can go back early and often as many times as they want to get a new certificate. They're not bound by this certificate to go forward if they want to go forward with the project. A couple of things I would highlight from the voluminous record, and I apologize to the appellant and the applicant. I don't think you're going to like my answer on this and my guidance to the select board. Just a couple of highlights from the file. The HDC did receive recommendations from the Sconset Advisory Board. Their memorandum is in the file materials. The advisory board had found that this was a contributing building, and they had a couple of quotes in there in their report. Quote, they would rather the applicant work with the original structure, and another quote, save the historic house. You know, they were pretty definitive in their recommendation to HDC. In follow-up to, you know, what Ray was saying, you know, in my opinion, they really did act within their jurisdiction on the application. I'd refer to Section 6 of the Historic District Commission Act. It talks about to raise a structure, and that includes, and this is what Ray was specifically talking about, raising a structure includes removing a structure from the premises. So this would qualify as a demolition, a raising of the structure. And, you know, in order to approve that, the Historic District Commission is empowered actually to refuse that permit if in the opinion of the commission, it would be detrimental to the public interest. So really the commission, based on the information in the file and the work they did on it, would certainly have been within their right to say, we're going to deny this as against the public interest because it's a contributing structure and we're trying to preserve this setting, and this is a historic facade that we're trying to preserve. So instead of just denying the demolition application here, appeared to try to work with the applicant to you know, accommodate their concerns, but also not allow the raising of that structure and the removal of that structure from the site. So that was why they, you know, conditioned this the way they did. It certainly isn't arbitrary and capricious as a factual matter. If you have an architect saying, we do this type of thing all the time, we're not suspending it in midair, there are ways of doing it. And another highlight from the file would be, there was an engineering firm for the applicant, and they, you know, addressed this issue of maintaining the integrity of that structure on site. And what they found is that it would be more expensive, but they definitely did not say it was not feasible. They didn't say, they had a lot to say that was very critical about the interior of the residence, but they didn't say anything like this structure is deteriorating, it's going to fall down, it's dangerous, it has to be removed. They just said it would be more expensive essentially to do this process of maintaining that portion of the structure on site while they did the rest of their improvement. So, you know, in my opinion, the commission, it's for you to hear the facts on this and make your own determination. But it's definitely my opinion that the commission acted within its jurisdictional authority on this application.
Thank you, George. Is it all right with the board if I close the public hearing at this time? Oh, Stephen?
Just one question for George, through you, Madam Chair. Excuse me. Which is that, does the HDC have authority to require the process of a building being suspended in midair, or is it more that the building should be retained on site, or these three walls I think we're talking about, since we're, if Kathy has clarified that we're not talking about the roof or the rear of the building or the pieces that have been approved for demo, that we're just talking about three walls. If those three walls are retained on site, but not necessarily, suspended in their current location, is that consistent?
George, did you want to respond to that? And then Val?
Yeah, I mean, I don't really have much more to say than I already said, is that they're judging this as to whether removal of that structure from the site would be against the public interest. It's clear that that was inherent in their decision-making on this. I tend to agree you can't, it's not for them to dictate terms and conditions of contracts or the way you're going to do certain work, but they can certainly have requirements. And, if they didn't impose a requirement that is so outlandish or not feasible, maybe that would be something factually you could overturn them on. But where there's no evidence in the record really from, the condition that they ordered is as a factual matter not feasible, I'm not seeing any grounds to overturn the commission on this.
Yeah, I guess it's still unclear to me whether or not on-site means on the lot or in its exact location, because there are members of the commission and the hearing who spoke both ways, that it's unclear to me from the decision what it actually means.
One thing I would add, respectfully to Stephen, Don, the alternative could have been worse, really, for the applicant. Based on the information in the file, really, the commission could have just denied it. They could have said, you're not proving that this structure has to be demolished. And we're finding that it's a contributing structure, is part of this historic neighborhood. The setting that it's in, we find it to be appropriate, and we want to maintain that setting. So that they could have just denied it outright. So, for them to, in a way, the applicant is almost trying to penalize them for giving a less draconian response to the application. So, to me, it's in their jurisdiction what they did.
Thank you, George. Val, did you have one final comment? Oh, Val, you're muted. You're still muted.
Thank you. It's interesting because back in the day when there was a situation where something had a zoning concern and we had to keep one wall or, a doorway even, there were so many different interesting ways people kept a structure in its place to help it along in its process. This is not picking on this particular applicant. In fact, I think we've been over magnanimous with the whole situation, and suspending it in air, as Stephen keeps bringing up, is just really over simplifying what's going on. And quite frankly, I just want to say, if we start and open this door, we may as well not even bother to have an HDC. Thank you.
Thank you, Val. I'm going to close the public hearing at this time. I have some comments, if you all want me to go, or if anyone wants to go first. Okay. I don't see any evidence that the HDC was arbitrary and capricious in this decision making. I think that it's very consistent with practices for decades of the HDC, and as Val had referenced, of the when people used to try to preserve zoning rights. I think that a remand is not necessary for them to work out these differences of opinion on how this is done. The applicant can certainly go back to the HDC as they see fit, and if the process is too cumbersome, they can change their design, maybe too much of the structure is being dismantled if it can't be, the walls that are in question can't be preserved. But it is not for us to substitute our opinions. What our charge is to see if they were arbitrary and capricious in their decision making. I don't find that they were in any way in preserving historic fabric of this original structure. And I don't think that a remand is really warranted for us to do. They can go back at any time with a new proposal or with a clarification of the method of construction to get blessed by the HDC. Fellow board members? Matt?
Yeah, I agree with Dawn. It's a pretty high bar, and for it to be arbitrary, capricious, and sometimes I don't like that, but that it is what we deal with, and I don't think in this case they're even close to being arbitrary, capricious. So, I support the HCC on this.
Are there any other comments? Is there a motion?
I move to support the HCC, uphold their decision.
Second.
George write a written decision.
So, sorry, deny the appeal and uphold the HDC.
Yes, thank you.
Second.
All those in favor by roll call: Matt Fee,
Aye.
Melissa Murphy,
Aye.
Jason Bridges,
Aye.
Christy Ferrantella,
Aye.
John Holgate, aye. Thank you all for your time.
Thank you, everyone.
Thank you.
I'm going to go back to committee reports as the final item on our agenda.
Should I sign off now, Madam Chair?
You're welcome to, George. Have a good night.
Thank you. Good evening. Thank you.
Oh, Christy?
Just a couple updates. There's a housing stakeholders group that meets monthly that was put together by the Community Foundation. And we met this week just talking a little bit about affordable housing around the island and just other community needs. And just one update that I wanted to bring to the attention of the community is the food pantry has still been really ramped up throughout July, still serving many of the community. I know we had a update from Taylor Hiltz the other day, but I just wanted to kind of keep that on the forefront of the select board members that, there's still a lot of people that are unemployed and struggling in this economy. They have had, the food pantry has had success being moved. So they were in the elementary school for a while in the White Elephant Ballroom. They're now back downtown. So they're closed right now, but will be reopening. But in typical fashion, they typically see a reduction right now, and they're not seeing that. So they're serving a lot more families than they typically have. I know last week when we had Dylan Fernandez on, Amy asked the questions about the Cocktails for Commonwealth bill, and that did pass this week. So now restaurants are able to provide cocktails to go. So just something that I think we should think about and maybe discuss is, I hate to go back to the word enforcement, but how are we making sure that people aren't drinking in public spaces or sidewalks or any kind of creating that scene downtown. So just something to keep in mind. The Affordable Housing Trust Fund met this week, met yesterday, and we spent a lot of time reviewing the RFI for properties to be purchased under the Neighborhood First. So we evaluated kind of what the criteria would be. A lot of that came from the Neighborhood First Advisory Committee, and Tucker kind of walked through the process of basically we would request for homeowners if they're interested in selling the property or land for this program. They would go through this process. All of that is in the Affordable Housing Trust Fund packet. It's all in the public packet. We also discussed 6 fairgrounds. So that is no longer in litigations with the neighbors. And so we are cleared to move forward. What we're waiting for is for a new round of grants to come forward through the state, because we are a housing choice approved by the Baker administration, which we signed off on a little bit after COVID started. We'll be able to compete in those grants. We're just waiting for the process of when the state is going to open them up. two more things, just community notes or for a future select board agenda. I think that we're having a real shift in our economy right now. We're seeing a lot of people extending their stay here, talking about moving here in the fall, or at least staying here if school's remote. And I think having the conversation about our Wi-Fi and municipal broadband, it's part of our strategic plan to invest in technology. So maybe an update from the department or some ideas and brainstorming around that. And secondly, just a discussion maybe around liquor licenses or restaurants being seasonal versus year round, and what that will look like as we go into 2021. If we have an expanded population, or last year we had so many programs with feeding our community, and I think we're going to bump into those issues again of our community being underemployed and needing meals, and if we have more kitchens to serve from, just something that we should be thinking about. So those are all of my updates. Thank you.
Thanks, Christy. That's really good. I actually recently put town administration in contact with a former summer resident who recently moved here, who's done a lot of fiber optics in Africa, and maybe we can see if that discussion went anywhere on an upcoming agenda. Libby's shaking her head yes.
Thank you.
And because that's definitely been a big topic of discussion, and my internet has been much worse than usual the last few days. Is there anybody else? We did have a CPC meeting this week, and the annual forum is going to be in August. I was actually just trying to find the exact date and time. I don't have it handy, but I'll announce that at the next meeting. And Libby and I, like I said before, did the Civic League's annual forum with all the different areas on Saturday. Jason?
Thank you, Madam Chair. I just want to say it's nice to see the sharrows and all the crosswalks painted. That was all done at night. I would come in the morning and they were just done. I never saw them actually being put down. So I know it took a while. There was procurement issues. I'm just happy that they're down and it's safer for pedestrians mid-island and downtown. So thank you for getting that done to DPW and town admin. And yesterday I attended the parent community advisory committee that Dr. Hallett's doing for the schools. As a community member, not really as a select board member, but I'm sure, I looked through that lens a little bit. But just it was really interesting for an hour to hear everything that the schools are dealing with and trying to accommodate everyone and teachers and students, and man, is it complicated. And so I just wanted to give a shout out to everybody that's working on that and trying to figure out how to safely get our kids back to school or do it remotely. And I think they're meeting every Tuesday, and it was just nice to be a part of that and listen to everyone's efforts. Thank you.
Thank you, Matt.
Yeah, we had a letter from a Peter Arzt, A-R-Z-T, I'll probably get it wrong, Eel Point Beaches, and some of the issues he's had. We've probably all read it. And I think we should be keeping in the front of our process is how are we going to deal with those issues in the evenings with, if we go back to an 11 o'clock close, we have to make sure that part of our planning is, the balloon's going to push out another direction. How do we do that? So that should be part of, just front of it. We should all read it if we haven't and think about it.
Somebody please forward that to me. I am not familiar.
I will.
Thank you. Anything else? Is there a motion to adjourn?
So moved.
Is there a second?
Second.
All those in favor by roll call. Matt Fay?
Aye.
Melissa Murphy?
Aye.
Jason Bridges?
Aye.
Vicky Parentella?
Aye.
Tom Holgate, aye. Thank you. See you later.